2020 special meeting of the State College Area School District Board of Directors, and I'd like to welcome everyone who is viewing with us remotely. At this time, I'd like to ask everyone to please join us for the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Board members, with an agenda before you, are there any changes to the agenda?
Oh, Amber, I had something I wanted to add, if possible, to make a motion that we end the meeting at 10 and then continue later if it's not finished by then.
Okay. So should we add that? Dr. Eder, would that be the sort of thing we would add as the first, as an action item?
I think conceivably you could do it at any point in time of the meeting, but I think it makes sense. I would do it now so that people in the course of the meeting have an understanding that we will or we will not be done by 10 o'clock tonight.
Okay, sounds good. Okay, so you would like to make that motion, Gretchen. Is there a second for that motion?
I'll second.
Okay, any discussion around the motion? Okay, sorry.
I can say something really quickly. Just that I think that you know, a one-off meeting going until 1 a.m. is one thing, but we've already had two. And so if this is going to be a continuing thing, I think that it makes more sense for us to make good decisions, you know, before 1 a.m. And so if it's going to be a regular pattern, that we would, you know, stop at 10 and then just continue whenever is appropriate. That's where my thinking was coming from, just to make good decisions while we're alert and awake.
Yes. Laurel?
My understanding is, from when I had looked at this before, that it's actually a fairly common thing to set a meeting time at the beginning and that there could be a motion later to extend that time.
Mm-hmm.
Is that accurate? You know, so often if you've set 10 o'clock, but it looks like it'll only be 10:10, people would extend for a particular reason or whatever. Is that accurate, that there can be a motion that's to change?
There could be a motion to extend, right?
Certainly. I mean, there's nothing set in stone with something like this, and anything that would get five affirmative votes will carry the day.
Okay.
But it sort of sets a parameter. This type of motion would set a parameter that we'd be considering. Thank you.
Yeah, come back to the idea of ending the meeting. Scott?
Yeah, I don't support this. I mean, I think it puts an arbitrary end on a topic that is extremely important to the board and the community and our kids. I mean, I'm fine, you know, kind of putting out there as a general consensus that, you know, look at 9:30, you know, 9:45 we'll pause and we'll reassess where we are. But I certainly would not be in favor of putting an arbitrary timeline on a meeting of this importance, especially when there's nothing scheduled for the future aside from Monday. And I'm hoping that we can make decisions prior to Monday.
Dan?
Yeah, just to join in with Scott's perspective on this in terms of taking the measure of where we are within the agenda and how we're doing in relation to the time involved. But there's a lot of pent-up energy in the community, and depending where we are at that time, like 9:30 or 10 o'clock, we may be through all of the public comment that might come forward, or we may not. And I wouldn't want at this point to suggest to anyone that we're trying to restrict the opportunity for people to offer their ideas in relation to the issues confronting the school district right now. So I would just wait, pace it, and see how things go. Maybe take the measure where we're at around 9 o'clock and then go from there. That'd be my preference.
Gretchen?
I just wanted to clarify. anyone who knows me knows I support public comment 100%. So this motion has nothing to do with trying to shorten public comment. It's simply to keep everyone alert and awake and then continue the meeting at a later time and date, not to prevent any public comment from occurring, just to clarify that 100%.
Right. And to follow on that, Gretchen, that is David's benchmark. I'll speak for David here a little bit, but he's of the opinion that anything past 10 o'clock is kind of a lost period of time as far as making thoughtful, gathered decisions. So if I'm not speaking out of turn here, David, but that has been something we've discussed before collectively.
I think if we can try and keep the meeting moving along as quickly, efficiently and effectively as possible, we make better decisions at 10 o'clock than we do at 1 o'clock. Okay.
It's true. This is true.
Okay. So without further ado, except we do need to have public comment on this motion. If anybody would like to make a public comment on setting an end time of 10 o'clock, I see there's some people with their hands raised. I'm not sure if their hand is raised in regard to just our meeting schedule or if they had a general comment. So this would be comments regarding the meeting schedule. Okay, I'll call on Kevin McGarry if your comment is in regard to the meeting time. And you would have 2 minutes. We established a 2-minute parameter for public comment. And if you could introduce yourself and where you reside in the district and unmute yourself.
Oh, sorry. My comment was not about the meeting time.
Okay, then we'll have comments at a later time. Thank you. Leah Witzig. I'm sorry. Leah Witzig, if you would like to make a comment on the meeting schedule.
Leah Witzig from Ferguson Township. And I would really like y'all to end at 10 o'clock. I am too old to stay up until 1 a.m.
Thank you. Okay, anyone else? Okay, then we'll have a roll call vote on that motion.
Ms. Brandt,
Yes.
Ms. Concepcion,
No.
Dr. Duffy,
No.
Mr. Fazzard,
No.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yeah.
Ms. Sidney,
Yes.
Dr. Bader,
No.
Ms. Bedell.
Yes.
Okay, so I think that establishes we would have a 10 o'clock adjournment for this evening then, since the motion carried. But again, as Dr. Eder had mentioned, if we get close to that and need a little wiggle room, we could reconsider at that time. Okay, Dr. O'Donnell, if you could now review some of the housekeeping items related to our virtual format.
Sorry, my first Zoom meeting. As a result of COVID-19, this will be a virtual meeting via Zoom webinar. Nick Zeppelhurt will serve as our host for tonight's virtual meeting. The IT help desk is available during the meeting if the community encounters technical difficulties. 814-231-7743. A few notes for meeting participants. When the board or community members want to make a comment or ask questions, please use the raise hand feature in the Zoom program access under the participants tab. For the public participants, there are two parts of the meeting. Well, in this case, for participation, public comment, which is noted on the agenda, and then if there's an action item, as you just learned. The host will lower hands and mute or unmute speakers as necessary to assist with the flow of the meeting. As a result of the pandemic, all board members are participating remotely. Policy 9 provides that where discretion is directly and or by implication granted to the board may depart from policy. Given the extraordinary times and circumstances we find ourselves in, and the board's choosing to exercise its discretion and depart from policy 3's requirement of at least 4 board members being physically present. This format also permits community participation, including the more than 500 attendees this evening. The board will continue to monitor the situation and make decisions on a case-by-case basis to continue or not with meetings in this manner. The board will return to strict adherence to the policy 3 as soon as possible. Thank you.
Thank you, Dr. O'Donnell. At this time, we have a roll call of board members. And so I'll call on the board secretary for that roll call. Thank you.
Dr. Bader,
Here.
Ms. Bedell,
Here.
Ms. Brandt,
Here.
Ms. Concepcion,
Here.
Dr. Duffy,
Here.
Mr. Fazard,
Here.
Mr. Hutchinson,
Here.
Mr. Leos,
Here.
Ms. Sidney.
So we're all here. At this time on the agenda, we have time for communications. If there are any communications from the board. Laurel.
Thank you. We have been I just wanted to say before we start tonight's meeting, for both the people who are watching and people who may watch later, we have been getting huge numbers of email, and I have, as I suspect all of us have, done my very, very best to read everyone. I have not been able to respond to most of them, and for that I am very, very sorry. And I just wanted to say that up front, if people have not heard back, it's not that we haven't read it, but you can scroll through and read faster than even sending a very perfunctory response. And many of the emails have been so heartfelt that I felt no response was better than a sort of, yeah, sure, thanks. So I just want people to know that I will be trying over the next, I'm a couple of weeks behind. I will be trying to circle back to everyone, but thanks.
Thanks, Laurel. And I would reiterate that sentiment. We've received many, many emails, and I've read every single one, but it has been impossible to respond to them all in a timely way. For those board members who were part of legislative discussions, I know there was legislative advisory committee, and I think Amy was also part of a PSBA conversation about upcoming legislation. Is there anything timely today that's more important to share today rather than Monday?
The one thing was in regards to an amendment to an offer piece of legislation that would require districts to bus non-public schools, so private institutions, during the COVID crisis. And much of the discussion in that meeting was that largely there are very few districts who are not doing that on a voluntary basis, and some concerns about codifying anything in that regard being concerning for future actions and future mandates and requirements. So they did ask that board members reach out to local legislators on that issue to preempt any kind of ongoing mandates regarding busing.
If I could add to that for a quick second, Amber, really interesting about that whole issue is that even school districts who don't have busing, they're walking district, those districts would be required to provide busing to students. So this doesn't pertain to us in this particular regard, but even schools that don't have buses for their own students would have to come up with buses for private school students within the rules of this mandate. And again, it's an unfunded mandate, but yeah.
That's really concerning because if you don't have a transportation department, creating one for this mandate.
I think those districts do already have to, in normal times, have to transport private school students. That was my understanding. So they already should be having to do that pre-COVID times. But the issue was that, some schools in some areas of Pennsylvania have gone all remote, and so then are not busing their students. And now they're being forced to put their staff members, they've deemed things too risky in their area, and they're being forced to put their bus drivers in harm's way because private schools have elected to stay in session. So it really incentivizes private schools to remain in session. There are a lot of financial benefits and other things to them doing that. And then the school districts are required then to put their staff at risk. So that was a big concern I had.
David, do you have anything to add from the Legislative Advisory Committee today?
There was a lot of stuff that was covered, but it could probably all wait till Monday.
Okay, sounds good. Okay, anything else from the board in regard to communication items? Okay, so then we'll move on to our information discussion item for the evening. Dr. O'Donnell, if you'd like to kick off this discussion regarding the health and safety plan.
You bet.
Oh, I'm
Thank-
sorry, Laurel, I see your hand up. Was that?
Yes, I'm sorry, I was having trouble with the buttons. It's really a question to you as our president. We haven't had many special meetings, and I was wondering if you could just briefly tell us how we got to be having one tonight.
Dr. O'Donnell, I think.
Yeah, I mean, I think last time we discussed not having any, the plan when we wrote it, and I'll speak a little bit to that in my remarks here, is we received some guidance from the Department of Health late. Our initial health and safety plan draft did not have specific cut points in it, and that was advisement we had with all our nurses and Gene Canals. I was there with Matt Ferrari, an epidemiologist who has, I spoke with him yesterday, and he's committed to continuing to support us along with Maciek. He advised us to not put the cut points in. When we did put the cut points in, we didn't discuss any type of consideration or decision points for reentry. And so that was the reason for tonight's meeting. We discussed that last week regarding a need to have an understanding of how we would make decisions that pertain to either remaining out or having any in-school opportunities. So that's really the gist of the request of tonight's meeting.
Thank you. Okay, so Dr. O'Donnell, do you want to?
Sure.
Open up the health and safety plan.
You bet. I'll share an overview of what we provided there, and I'll have Randy Brown share some specifics. And the reason we're discussing process tonight, and we don't have any of the safety team members with us, but I can tell you that the safety team members have helped us develop, what are the most important data points. The epidemiologists that are helping us really have been key to that, and also helping us monitor those. Local physicians and our medical providers are helping us get daily data from our community. That's something we didn't know back in the summer. They're all very committed to helping us work through these difficult decisions. If the board does support the proposed amendments, the safety team is committed to helping us to make difficult decisions. This isn't, we have many difficult decisions ahead, some that we know that we're gonna have to make and some that we don't know. And the safety team is 100% committed to working with us and wrestling through these challenges to try to make the best decisions for the health and safety of our staff and students, and determining if it is safe to return to our schools and implement our plan for any in-school opportunities that we might have. So, right now we're in the middle of a remote week, and I think thanking the students, families, faculty, staff, and our administrators in the district for their commitment and cooperating during this tough time. It's this past week, the support for remote learning to date has been impressive, and I'm incredibly appreciative. For our board here, and this is tough. We've had our disagreements, but we're all on the same page, just stressing about some of our common desires, and we want to ensure the well-being of our students, employees, and our community at large. And so I appreciate your commitment to the district as we work through these tough challenges. So tonight, I hope the proposal, as well as our discussion, helps you better understand how we might approach these critical decisions regarding if we're able to be in schools or During August, when we set these markers, we did so without much discussion or involvement of the entire safety team. And that was really due to the timing of, as I said, of DOH's release of those guidelines, as well as our effort to advise the board regarding the state's requirement, because the board was required to approve the safety plan. And we know a lot more now than we knew then. In addition, we were very focused on preparing our facilities and our staff, as well as communicating a lot with our families. So after all of the meetings that I've attended with our safety team, Department of Health, I just had one a little bit ago today, and PDE, as well as our administrators and the ongoing meetings I have with association leaders, I'm going to share what we know now and my thinking, at this time. But I think it's more about process and how we would approach these decisions. Clearly, I think we need to make updates to those decision-making parameters. However, the evidence of safety is just as critical now as it was when we talked about this in August. As it becomes more clear recently, we face a growing COVID-19 presence, as we all know. The recent DOH releases have shown a significant increase in positive cases in our county and our school district community, and the overwhelming majority being Penn State students. We're closely monitoring the data also from Mount Nittany, which includes information from Penn State Health, and we're also looking at Geisinger's testing data on a daily basis. And that community data is a significant number that we didn't have in August as well. And we're seeing a 1% positivity rate over the last 7 days from those providers. And they are the primary providers in our community. And that rate, I think, is a data point in the 17 cases over that week. That's a data point that our decision-making should consider. That's to emphasize our change situation in August. When we formed our plan, we didn't have access to that kind of information, and we're appreciative to the partnerships and the information sharing. While we experienced only in-person school for 7 days, our mitigation efforts did work well. Since the start of school, we have not received any reports of any positive cases among students or employees. Also of note, as of September 8, the university had no positive cases among employees that were reported. And I know that this week they restarted their testing of employees. So I think that's a data point that we want to keep an eye on as a community, regardless of whether we're in school or remote. Obviously, none of us has a crystal ball regarding the future. However, as we look at how other communities across the state and nation have fared during recent months, we have to be prepared for positive cases to impact our school community. And in fact, we could expect to be fully remote at some point, like we are this week, or a period of time, or for a period of time, due to cases directly impacting students or employees. Given our situation, I'm requesting the board reviews the proposed amendments. And as I said earlier, our safety team, including Maciek, Dr. Huggins, Dr. Dross, as well as I said, Matt Ferrari continues to collaborate. And, they're committed to continuing to work with all of our district nurses, Jean Knaus, myself, and our administrative team to do our best to make decisions regarding our status. So in the document that I shared with you, there's some key components that you see, and Randy's going to help us with some of the updated data points for you and hopefully address some questions. The objectives, we want to understand COVID-19 in our community and identify when it's safe to have students in schools. Obviously, when we are in schools, we want to make sure we're preventing transmission of COVID-19 if it is in our schools. We have proposed an approach that does look at the data points that our health and safety team's been analyzing, and we would utilize all those points that you see there as we consider decision making. We also included some additional precautions, in some discussions with leaders, specifically of SCAEA. This idea of helping with random screening, because we know how busy people are in the mornings, families as well as employees, and perform some random health screenings. We have a large number of thermometers, and we also know that the daily screening checklist is something that we probably have a lot of students coming in whose families don't take the time to take a look at it. So we think we can help with that. Our nurses, as I understand from Jean, sent home approximately 90 students who had some type of symptom that was part of our protocol to send home. We've also worked with several employees, and so we think that the screening will help inform them as well as another step in our work. And I think one thing that Mr. Brown's working on with discussions he's having is to see if we can implement a strategy for random testing of our employees. You know, we want to understand if we do have asymptomatic adults in our schools, and it'll also better inform our decision making with our team. So that would be a data point we would absolutely consider. When it comes to employee safety, you know, I appreciate our HR office and the team there working closely directly with employees over sensitive issues. And, you know, we've adhered to requirements provided by medical professionals to make sure that we're responding to employee needs, and you know, and we continue to work through that as employees communicate concerns and some of their health needs. You know, in conclusion, I think if the board supports the amendment, we would execute that collaboration with our health and safety team, and it also would include the Department of Health officials. We're meeting twice a week now, and they do have an epidemiologist in the mix with their team. And you know, my hope for them is that they'll collaborate specifically around our community and what's happening in our community. And that's they have spoken more at a county level to all of our superintendents, including the heads of our local charter schools and myself. And that's been my request of them, because I find that discussions with our epidemiologists in our community, as well as our physicians, are focused on what's going on specifically in our community. So, you know, that's my hope that we can get some more applied responses to what's going on here. So with that said, I'm going to ask Randy to share some detailed information. I didn't walk through each of the variables that we included in the memo for the sake of time, and but then we'll field any questions that you have. So Randy.
Thank you, Dr. O'Donnell. If the presentation could be shared with the group. Thank you. You can go to the next slide. The question has been raised multiple times: where are we gathering our data? And first and foremost, we are gathering our data from the Pennsylvania Department of Health. And for those of you who aren't aware of this website, the link is on the bottom of the slide. This presentation is now available on the meeting, added as an attachment on the board agenda. If you're unable to find that, feel free to shoot me an email and I'll help you out with that link. If you so need. This website shows, has a dashboard here that starts with Pennsylvania cases. What I've shown here is the Center County data today. There were 877 confirmed cases, 48 probables, and then shows the number of negatives and the number of deaths. This is a cumulative tabulation of data. And then there's also some graphs there. If you look real closely, or if you look on your own screen when you're logged into this site, you can see that there's other additional information. Primarily, I go to the next tab for zip code case data and pull off the various zip codes for our school district as well as the rest of the county. You can move on to the next slide. For the last 7 days, I've included our county data of new cases here for you to as a tracking, just as an example of, and obviously we have seen some larger numbers as well as you know, than we had been, as well as a very large number yesterday. If you can go on to the next slide. The Department of Health is providing this case data by county, defined as confirmed, probable, and total. Obviously, I talked about that. Generally, the total positive cases is released to the public when you are talking about seeing it in the newspaper, and in that case, many times they are added, the combined and probable are added together. When I am looking at the data, I am looking at only positive cases or confirmed cases. Go on to the next slide. When we're looking at cases by zip code, I use that for looking at district case information. Zip code information includes only confirmed cases, and case information by zip code is released only after cases reach the total quantity of 5. So that means that there are several zip codes in our district and also obviously in our county where the number of cases have not reached 5, and I'm assuming that they're withholding this information for privacy purposes, to not identify specific individuals within those zip codes. And so when I'm looking at the different the increases from one day to the next at the county level, I may not always be able to identify, or you may not even be able to identify the specific zip code that all of the cases are associated with. And then once they reach the quantity of 5, they become evident and are released. And sometimes there is a jump of more than one case in a specific zip code when you're comparing, because now poof, a zip code becomes available. If you move on to the next slide, please. For your information, board members, and also the community, the zip codes that we are looking at when we are looking at specifically the school district, we're looking at 16801, 2, 3, 4, and 5, as well as 16827 for Boalsburg, 51 Lamont, Pennsylvania Furnace, Pine Grove Mills, and Port Matilda. It should be noted that Pennsylvania Furnace and Port Matilda, as well as potentially Pine Grove Mills, also include parts of neighboring counties. We have no way, at least I have not determined a way, and I've spoken to other professionals in the community to disaggregate that data between Center County and the neighboring county. So we are assuming that all of those zip codes, all those cases are assigned to Center County in those zip codes. Moving on to the next slide. So I talked about Pennsylvania Furnace and Port Matilda. Some members of the community may wonder why we're not looking at Warriors Mark. After talking with some folks at the Center Region Council of Governments and how they are monitoring the data, they are excluding Warriors Mark. There may be some cases there, but the vast majority of those residents are in the neighboring Huntington County. And so since we are including Port Matilda and Pennsylvania Furnace, we feel that it kind of balances out any potential cases from Warriors Mark that we could be missing. Moving on to the next slide, please. So looking at the district cases for the last 7 days, I've just included that information as well. And if you compare, as we'll see in graphs ahead, but if you compared the totals for the district and the county, you'll see that obviously the vast majority of the cases in Center County are in the State College Area School District. Obviously that makes sense because we have the most residents and highest population. Moving on to the next slide. Oh my goodness, that is a terrible graph, isn't it? Let's move on and hopefully we'll get a better one on the next slide. Well, I apologize for that. That goes to show that I didn't look at my graphs very well. I was trying to show you in these two graphs how since middle of March, in the early part of March, and I will place these and have them posted on the website, I apologize. But what these graphs should be showing you is a level amount of cases earlier in March, or in April, excuse me, August. I get my bearings here. I'm watching the screen too much. And then once we hit about a week and a half, 10 days ago, then the cases started increasing very dramatically.
Hey, Randy, to let you know, the PowerPoint presentation, those are absolutely fine. So if anybody goes on the PowerPoint presentation, they can see the graphs.
Okay, I apologize. It's just then projecting. Thank you, Mr. Fazzard. If you move on to the next slide. There we go. That's what it's supposed to look like. Thank you, Nabil. So those slides now show you how we had some very level of the cases, and then as you got closer to the recent period, the increases occurred. Okay, can you move on? You can skip that one too. We've seen that. So the next two slides here, what I'm showing is these are the district and county levels of the 7-day cumulative new cases with the parameters that were in the original health and safety plan. So what we were saying then in that plan is that the green bar shows that if we had fewer than 50 cases in a 7-day cumulative period, and those cases all being in the district, then we were in what I'll call a green section, or a low transmission phase. If you moved into the yellow area where we had 50 to 75, that would be an area where we would evaluate. But once we got to 75 cumulative cases over 7 days, we would be probably in a fully remote scenario. And you can see that on the bottom bar shows that right now we're at 320 cumulative new cases in the school district. Moving on to the next slide, have the same color coding, but it was between 80 and 120. Below 80, we were good. Between 80 and 120 is where we would evaluate, and then above 120. And at the county level, we're at 347 cases. I prepared the next slide. Thank you. And this slide is to show that if we disaggregate the 16802 data, which is the Pennsylvania State University resident cases that are assigned to zip code 16802, then we would only have 275 cases in a 7-day cumulative period. And that's part of the new amendments to the health and safety plan that we would be proposing. However, we're still in a high level at this point.
Randy, the 16802, just for the community's benefit, that's only dorms and university housing in 16802.
Right, on campus housing.
Can you pull that up so it's in the main part of the screen?
I'm not sure what you mean. It is
the bigger picture is still the green, yellow, and red, but you were talking about the one below that, I thought.
Yes, the black is 270. You can't see that on your screen?
No, I'm sorry, I was mistaken.
Okay. All right, going on to the next slide. This slide I've put together to show what the impact is of Penn State University cases. And so what I've done, if you look in the middle line there, it says PSU, and there's a number 415. And I've taken that from their dashboard that was updated yesterday, that assigns the number of cases on University Park campus. And what they started testing on August 7th. So if we take a look at how many cases that have been attributed to Center County since August 7th, and I'm calculating that by taking yesterday's data count of 822 and August 6th data of 326, subtracting and getting the difference of 496. Subtracting 496 from 415, then that leaves us with non-Penn State University cases of 81 in the county. If you do that in the district, which is on the right-hand side, we get 34. So obviously some of this data is coming from different sources because Penn State is attributing their data and providing that on their website dashboard. And then the rest of the data for county and district is coming from DOH. I am assured by folks at Penn State that the data does come from, the Penn State data, test data does go to Department of Health. There may be a slight timing difference, but, and that's why I went through yesterday's case data of 9/9, because, and while Penn State had just updated their dashboard on Tuesday. Okay, going on to the very next slide, moving away from case numbers of cases, but we've been talking about, and I had promised to begin providing some information about the costs that we have associated with the COVID pandemic. And what I've assimilated here is costs through August 31st of this year. And you can see that we have expenses associated with remote learning of almost 700,000. It goes down to some employee training of 2,200, and it's a total of $2.1 million. Obviously, we are now on September 10th, so that number is no longer valid. Since August 31, I'm sure that we've spent additional money on many different items that are listed here, and we've tried to group those for you in the best way manner possible. We have been awarded some federal and state funding of about $1.3 million that will help cover these expenses, but we are still, we've still had to take out of the district budget about $800,000, and that number is still counting. I cannot think off the top of my head or speak right now of any specific items that we have yet to purchase. Specifically, I believe that most of the remote learning and softwares and website initiatives and textbooks and other learning materials have been purchased. However, I'm sure that there are some still yet to be identified or needed. And as far as the personal protective equipment, such as gowns and masks and shields and gloves, we have a supply for a reasonable period of time. Some items may be, another month. Some items that we have may be several months. So we'll continue to take monitor of those and continue to make purchases of those. And obviously these items vary in cost. So we'll, I cannot begin to guess how much more dollars we'll be expending on these supplies. Obviously, it also depends on how much we're in remote and how much we're in person. So that's what I have for you tonight. I hope that gives you an additional flavor of what we are talking about with the cases, and then also what we've expended. Is there any questions?
Lori, I see your hand up.
Yeah, I think I just have, it may just be one question, but depending on how clear it is, I might have a follow-up. So first of all, Penn State could not, their information couldn't be more difficult to discern, just on a daily basis, trying to, the sudden dump of 184 cases was not recorded on their dashboard as recent cases. You have to disaggregate it from the total. So that's complex. So Penn State students not living on campus are a concern for me in terms of our not counting them, because I'm not feeling confident that we can guarantee that those students aren't isolating. So I'm just putting that out there as a red flag to me in terms of how we're counting students in our school district.
They are in the numbers that we have. The ones off campus, Randy, You just said the ones off campus.
The ones on campus they were taken out of that one slide, correct? The off-campus students are still remaining in our counts.
Okay, so then I guess this leads to my second question, which is how are we defining community? So when we have community cases reported and we only see 16, how are we defining community? What's the definition of those numbers specifically? How are we getting 16?
Can you give me an example of where you're seeing 16 so I understand? There's a lot of different places where we.
Sure. So on the memo, it says community cases reported via daily updates from Geisinger, Mount Nittany Health, and Penn State Health. As of September 10th, the total cases are 16.
Okay, so perfect. That's a good question. And what I have found is that I may have a career in epidemiology if I go back to school, because I'm working very closely with a lot of different numbers from a lot of different places, and working with Dr. Boney, I believe that's something that he does very often as well. Those cases are the ones that are coming. I don't know if they're residents. I don't know if they're off-campus students. They may even be on-campus students that are residents of the State College area, and they go to those doctor's offices. But those are specifically, I get daily updates from a Geisinger contact and from a Mount Nittany Medical Center contact. And Mount Nittany Medical Center is also processing cases, tests for Penn State Health. So that's not an all-encompassing, all doctors' offices, physicians' offices, and all testing centers in the county or in the school district or in the State College area. But that is what we believe to be a fairly large sample, and that is what we've been able to gather. And so I can't say that that's not including some of the Penn State students, because as I understand it, Penn State is able to somehow gather information from not only their testing centers, but also other testing sites or Department of Health. I'm not sure how that exactly works.
Okay.
So does that answer the question?
Yes. One red flag about this aggregation of data is I don't know what the percent positivity rate might be from like MedExpress or the Walmart parking lot Quest, just because I got a COVID test a couple days ago because I want to visit my daughter and I don't want to get her sick. And it was streaming with Penn State students getting tested. And so with kids who were saying that they associated with somebody who had COVID and they sounded sick. So there may be places that have higher positivity rates than others just because students feel like it's a more accessible place to go. So I guess I just want to make sure that the way we define community and the numbers that we're considering are actually giving us good parameters by which to make decisions. So I'm just sort of throwing all of this out here as things that rise up as red flags to me. The fact that a lot of Penn State students are not going where we think they're going for testing, perhaps. And so I'm just putting that out there as information for everybody from my point of view. So
Nabil, could you bring up slide 14 again, just for exploratory purposes, please? What I wanted to show you, Lori, is that all of our numbers include all Penn State students except on the slides that you've seen, except for slide 13, which I did take out the 7-day total for 16802. Right. And then on slide 14, this is the only slide where I have separated out or disaggregated the Penn State numbers. And quite honestly, I did this because of the timing issue that we had, because the Penn State web dashboard threw up this 415 number on Tuesday, and through Tuesday from the data from the health department, I didn't have 400 new cases since August 7th.
Yeah.
And once DOH got caught up in their reporting. And we understand that there, there's nobody in their right mind, let alone on this great green earth of ours, that I believe can match up any of this data, because it's coming from different places.
Right.
And so that's why we're using multiple different sources and trying to, this to me was the head check. Hey, is our DOH data correct? And is it in comparison to our Penn State data?
Yeah, and Randy, to be clear, this isn't a critique at all of what you're presenting. It's just to make sure that as we put this in, as we make these decisions about what our parameters are, that we have a clear understanding of where we're drawing our numbers from and whether or not we feel that's an accurate assessment of what's actually happening in the community. So, but thank you. I totally appreciate it.
I completely understand. Thank you.
Thank you.
Dan? Oh,
You're
Dan.
muted.
There we go. If you could unmute yourself. Oh, Dan, you're still muted.
Hold on. Yep.
There we go.
Okay, sounds good. Yeah, Randy, if we can go back to slide 14 again. I'm sorry, I'm a little slow in terms of making sense of all this. So go back to 14 with the one you were just on. In terms of the headings, the column headings. Excuse me.
Nabil, did you catch that? Slide 14 again, please.
Yeah, I have a lot of windows open here. Hold on.
Okay.
Great, thank you. All right. So in terms of the columns, there are two sets of columns. From August 6th and September 9th, and then the difference column and so on. And it's about positive case analysis. One of these, I suspect, reflects our zip codes, and the other one reflects the entire county, perhaps. Yeah, there we go, county.
And district, yes.
And district, got it. Okay, it has the zip codes. Okay, sounds good. And so, and one of the things I reflect on is that it's not surprising that Penn State students would be so thoroughly represented within 16801, for example, because most students live off campus. They don't live on campus.
Correct.
University got out of the business of providing housing for students about 20, 25 years ago or longer ago. So it's not surprising. So essentially, we look at these numbers as we go down the columns. Essentially, what you're essentially saying is that there are as many within the county. There are as many as 81 cases that are non, in terms of these increases, that are not from August 6th to September 9th. 81 are non-Penn State students within the entire county, and then there are 34 within our zip codes that are new since August 6th, who are not Penn State students.
Correct.
Okay, and the implications of that, of course, is to the extent that, well, of course, the Penn State students will be engaging with their faculty and with staff members, and a certain number of our families are employed at the university. So the students would have opportunities to interact with them, and there might be some sense of risk in all of that. So, but all in all, and most of the risk is associated with the Penn State students who have been tested and come up positive.
Correct.
Okay, thank you. That's it.
Well, there's risk from the ones who are not yet tested, but
Those two, right? Exactly. And we have asymptomatic. I mean, there are a variety of possible ways in which people can present risk.
Well, I mean, I think their asymptomatic testing has indicated that there's a significant percentage of infected students who would not know they're infected and are walking around.
Right. Thank you.
Randy, do you know the asymptomatic cases, they are not at this time being reported to the Department of Health until after they have been rescreened through a diagnostic testing procedure, right?
I cannot answer that. I'm sorry.
Okay. That was my understanding from reading some of what they had put out over the weekend about those. Laurel?
Thanks. Couple of questions. Let me get back to them. Sorry. Do you know, thank you. This is helpful to see some of this. do you know about how many students are in that 16802 that Penn State houses on campus?
believe I remember seeing that approximately 70% of their 13,000 available beds are occupied. So it's about 10,000, between 10 and 11,000 students.
So about, if I remember, that means about 30,000 students are out in the community at large. Is that right?
Well,
Actually, Laurel, I asked this of the Penn State rep at the last meeting, and he said they don't have quite as many students returning this year. They estimate about a total of 35, Randy, is what I recall. And he
I
said
think
about
so.
10,000 in University Housing on campus. So that leaves about 25,000 in the community. Is that what you recall, Randy, as well?
yes.
I would ask, but I couldn't find it in my notes. Thanks.
That's what I recall too.
So another question is this issue of zip codes. If a student gets sick and goes somewhere and gets tested, and I assume the ER comes up as either Mount Nittany or Geisinger, is that right?
It
If
would
you're
be
tested
Mount
at the ER.
Nittany. The ER would be Mount Nittany.
If that student, say, lives in Altoona, that's their zip code, do they get reported? How do they pick what zip code it is?
They are to record their local zip code. So if the person actually is a commuter student to Altoona, from Altoona, then they would put Altoona even if they get tested here. But if they're tested here, but if they are a Penn State student and they get attributed to through Penn State's testing somehow, which I understand can occur either through the testing site or through Department of Health, then it would be counted there as well.
Okay, thank you. And the last question, I think you answered a minute ago, but I'm not positive. What about the places like the doctor's offices, like the one that's next to Walmart or the one Lori was talking about? Are those being recorded anywhere other than the DOH numbers?
Not at this time, no.
And MedExpress is potentially a significant source of testing.
Potentially it is. Quite honestly, I'm not familiar with what their volumes look like.
They use LabCorp, which is a significant, yeah. So I don't know, but we had an hour and 45-minute wait there when we went. So it was packed.
So then what we're looking at as potential numbers for community members, if it doesn't include the MedExpress, we could be mistakenly assuming that a chunk of DOH numbers that we're seeing are not local residents, whereas they may be if they've gone through MedExpress then. Is that correct, Randy?
I'm sorry, I need you to ask you to repeat that again.
So because MedExpress is not reporting to us their results the way that Geisinger and Mount Nittany and Penn State Health are.
Correct.
Their testing results are showing up in the DOH data.
Correct.
But with the way that we're currently taking the results from Mount Nittany, Geisinger, and Penn State Health and assuming that those are non-Penn State students, are you assuming the rest are Penn State students? Because my concern for missing the MedExpress and any other potential providers that might be doing a certain amount of testing, how do we know
we're just using the Geisinger and Mount Nittany numbers as another data point, and not. I mean, I don't think that we're relying. What we're hoping to do is we've been gathering different data, and I can try to reach out to MedExpress and Quest and try to get that data as well. But what we're trying to do now is just get different data points that we have at our access. And some of them are not easy. They're additional conversations and relationships that we're building throughout the community. But I'm not trying to say that this is, the only comparison I was trying to do was that slide 14 in the presentation about non-Penn State, because I would assume that if a Penn State student is going in, and I believe that Penn State did work with a lot of the different testing providers to make sure that they, a college age student gets identified as a Penn State student so it can get into their database as well.
Okay, I guess I'm still a little concerned that we could be, if we're basing that, the number that we are seeing from Geisinger, Mount Nittany, and Penn State Health, and thinking that those are the community-based, like locals cases versus Penn State student cases, we could be missing a big chunk of cases.
I agree with you. Again, I'm not making that leap. I'm not proposing that we make that leap either. I'm just looking at one data point.
Right, just saying that those numbers are what's coming from those providers.
Right, and quite honestly, from those 3 providers, not all of those people are going to live in our school district, and they may not even live in our county either.
Okay. Scott?
Yeah, I guess, no real questions. I mean, I think the presentation was pretty straightforward. I key almost exclusively, in my view, on that slide, 14, which shows the PSU positive case analysis. And I'm not sticking my head in the sand and trying to say that I don't think that the Penn State students couldn't have an impact on the community. But what I am looking at, and I'm saying to this point, they haven't had an impact on the community. So, when you look at 34 cases outside of Penn State in the last month, that tells me that so far there hasn't been an impact. Now, could there be? Yes. Will there be? Well, we don't really know that. I think we all probably realistically expect there to be. But on the other hand, when I'm driving on campus, it's like a ghost town. I mean, it's like the summertime. There's nobody out and about. I don't see people. Now, granted, I'm more in the evening, not during the day. But last year there were kids everywhere walking around, and I just don't see that as much. So I don't know why that is. I don't know whether that's because there's a lower student population. I don't know whether it's because the Penn State students are behaving themselves more than we think. We just don't know. So I look at that slide and I see 81 county cases outside of Penn State and 34 district cases outside of Penn State. And to me, that says that we don't have any district spread at this point. And boy, we're losing the opportunity to have kids in school. We lost one day for really no reason last Friday. We're going to lose 4 days this week. And we have very, very low community risk at this time. And I just think that's a shame. I don't think that that's what we should be doing. There's conversation obviously about these are dangerous times. Well, it's dangerous to cross the street. That doesn't mean we just walk down one side of the street for our whole lives. It means we cross at the corners, we cross at the crosswalk, we look both ways before we cross, but it doesn't mean we don't cross the street. And this health and safety plan, that's our crosswalk. That's how we're getting from one side of the street to the other. And originally we thought there was a lot of traffic on the street, and now we're not so sure. So the administration's asking us for some flexibility so that when there's a lot of traffic, we can react one way, but when there's no cars coming, maybe we can react a little bit differently. And I think that makes a lot of sense given where the numbers are and where we're seeing the numbers at this time. If that changes, hey, the plan is written in a way that allows them to make those decisions if they see district spread and they see actual community spread outside of the Penn State students. The other thing that really I kind of key on in this is, I just don't see fairness to the families who want their kids in school. We can sit here and we can debate what's right, wrong, or otherwise, but anybody who wants to be remote in general has that opportunity. They can go remote, they can do virtual academy, etc. But we're taking away the opportunity for families who truly believe that their kids should be in school and that they want them in school, and that whether they're right, wrong, or otherwise, they feel that it's a safe environment, and we're taking that away from them, and they don't have an option. And I just don't think.
I felt like at this time in the conversation, we were working on discussion about like what our questions were on the slideshow and the data that we were looking at. I'm just not sure if everyone was ready to shift to a what do we do with this information discussion yet.
Thank you for that, Amber. Thank you for correcting me.
I'm just trying to figure out where we are in the conversation. Gretchen?
Yeah, I just had a quick question for Randy about the number 16 cases as of September 10th. The total cases are 16 with a 1% positivity rate. So Randy, is that 16 excluding PSU testing? That's where that number comes from? That'd be Geisinger, Penn State Health, and Mount Nittany?
Yes, that's where it came from. Geisinger, Penn State Health, and Mount Nittany. And that's just the last 7 days data.
Okay, so excluding the Penn State testing.
Absolutely.
Okay,
Yeah.
Okay, thanks. That's the only question I had.
Okay. Any other questions on the slideshow in terms of the data so far?
I have a quick question, Amber. Excuse me. When we and Amy, you have a great mind for this kind of question. Last week when we had the Penn State representative join us about the various mitigation strategies and isolation strategies and so on, he did talk about the routine that they followed for individuals who tested positive, and they had Eastview Terrace set up for that. And just to be clear, if we have, and I think this was part of the presentation this evening, Randy, you might have mentioned this, that in the event that we have cases for students that happen to live in town but don't live on campus, would they also be required to isolate?
He answered that question, Dan. He said that they were being offered the option to isolate at their facilities, and according to him, the majority were taking the university up on that. What I realized after that meeting is the challenge is when you look at their data about the number of people in quarantine and isolation, it's just really difficult to interpret because based on some articles in the Daily Collegian, some students are only isolating there for a couple of days until their family are able to come and get them. And then they're returning home to further do school remotely from home, wherever that may be. So it's hard to look at those numbers. There could be, I was admittedly a little critical about the numbers seem pretty low based on the current case rate, and that there should be more people in isolation. However, the tricky part is I think some students don't stay there for their entire isolation period. Some of them are going home to be with their families. So that number is probably in flux. Certainly a big number there would be very concerning, but again, hard to correlate it to the number of cases as to whether enough people are isolating, since we know that they're not necessarily staying there for the entire duration of 10 days. Yeah. Is that where you kind of were headed?
Basically, yeah. And I could see
it's hard to look at those numbers and know much about what students are actually doing.
Right, and it's hard to really have a great deal of confidence in what a 18, 19, or 20-year-old would do when asked to restrict their freedom in favor of the general good. Just developmentally. One other piece of data that's out there is a photograph posted by a student of her cot, if you will, in her isolation room, which was pretty barren. It was posted, I think, on Onward State. And my sense of it is it wasn't an attractive place or a very welcoming place to have to live. So I suspect some of the students in that situation would be inclined to go home and be, in a sense, off campus, like working remotely from home. That's it. Thank you.
Laurel?
Thanks. this may be hard to do because it involves, so that you've mentioned this 415 number from the Penn State data. And Lori pointed out, I think very accurately, that that Penn State site is so hard to figure out. And I can't find 415 or even something that is sort of remotely close to 415 anywhere. So this may have to be something you get back to us up. I don't know if you have the ability to go to that website from your screen so people can see it. But like I'm seeing that there are 447 current week awaiting results, and there were only 36 positive cases. And then the total since 8/7 was 433. So that's closer to 415, but that's going back to the beginning of August. So where is this 415 number?
I'll have to share something with you later.
Thank you. I've
believe
heard
that I can
it
pull it
said,
up.
yeah, I just would appreciate that because I'm trying to understand it. I mean, when you initially look at the Penn State website, it looks great. Gee, we've got 36 cases from the on-demand and only 6 from random. Okay, 40 cases out of a 35,000 student. That sounds pretty good, but so I would appreciate seeing that later. Thank you.
Randy, was that all in terms of the slides?
Yes, that's all I had.
Okay. All right. Any other questions on these slides or comments? Okay. All right. Bob, can I turn it back over to you for further discussions? We work through the memo.
Sure. I think any questions that board members have regarding what we've shared here or anything that I've discussed or obviously the memo points, Randy went into some detail regarding some of the current data points.
Okay. Lori?
So just in terms of what new parameters would look like I understand the Center County incidence rate recommendation. I absolutely get that. I understand why you would want to disentangle Penn State infections from the 802. I get that. What is the measure by which, if we're looking at this from multiple points, what is the percentage of community cases that you would see as being a point at which we would add this as a concern and consider going remote? What's a relatively fair number would you throw out? Because I see what we have, but I don't know what the recommendation is as a community case number.
Yeah, well, Lori, what we would do is basically, as I shared, we would take it and have a discussion with the safety team and let them share their thinking. And I'm sure there'd be disagreements, and we'd work through what are the concerns that people have and what are the suggestions regarding whether or not we reopen. I mean, I think that's what we're suggesting. I'm not putting a weight to any data point, and if
that's not what I don't mean a weight. I mean, what would be a concerning percentage rate, I guess. That's
I think obviously the different markers we have from DOH are something that the board discussed. And you had a 5.5 to 7.5%. If we used percents, I would ask the safety team to weigh in on that. And if Randy obtains more data from MedExpress and we can identify that it's local, I think we need to include any data point that we get and consider that. Obviously, taking a look at the community, taking a look at what we've experienced with our employees and students is just one key factor that I think we haven't considered at this time that we'd weigh into that discussion with those people. So I didn't, when we talked about it with Matt, and I know Jean's here with us, we were advised to not have cut points because in some cases it depends if something's rising. If we could see a spike in the number of cases in our local community, and I don't think it would be something we wouldn't see in our schools. You know, I think our parents have been very collaborative with us, but obviously we want to look to what evidence we're getting from our healthcare providers in case a parent doesn't tell us that a student tested positive. Now, the one thing to mind you that the DOH will call us with positive tests. They had shared that we would receive a direct phone call regarding any students who would test positive. For employees, we've been working closely with the employees and then help who have been symptomatic to either get them tested or if it was a family member. So, but as far as what would cause concern, I mean, obviously I'd look to the safety team to give us some advice for my, involvement in a ton of conversations. Obviously, not just flat or just basic numbers, it would be spikes in numbers. So even if the percent positive doesn't jump because they happen to give a decent number of tests, just the actual numbers increasing would be a problem. If that 17 or 16 that Randy shared became a 40 in 2 days in a row, that's what we saw. That would be pretty alarming.
Okay, that's helpful.
That's my opinion on it. Yeah.
If I could add, we are trying to get more and more detailed information from all of the providers, and we'll continue to reach out to other testing providers, especially because if we're seeing that, we don't want to make any false assumptions. And what we'd like to have is about the tests that the test results that we're getting from Mount Nittany and Geisinger, we'd like to have zip codes and age ranges, if at all possible, because that would again help us to disaggregate the data a little bit more, just to understand what we're looking at.
Gretchen?
Yeah, Randy, I think that's really key what you just said. And that was actually one of my questions, because I understand that we're doing our best and looking at Mount Nittany, Geisinger, and Penn State Health. But I was just curious what percentage of local tests are coming from those three entities. And, just to get a better picture of how much information about local positivity rates do we actually have versus what we're assuming we have. And because I know that there are, other local ways to get a COVID-19 test through MedExpress, through, if it's an independent provider, some of them use Quest, and there are a good amount of those tests as well. And so I was wondering what percentage of local COVID-19 tests come from those three entities in terms of how much information do we actually have? That was one of my questions. And then I have one other one.
I don't know that answer. I'll have to do some diving to compare. I know the number of tests from those entities, but I want to compare that from the number of tests that are in total from the Department of Health.
Yeah, that kind of jumped out at me. And then the other question that I was wondering about has to do with the 16802 zip code. And it's, I guess, more of a scientific question, but we know how this virus spreads, and this virus doesn't care whether you live in 16802 or 16801, or whether you have 1 foot in 802 and 1 foot in 801. And if there is an explosion within the increases in 802, eventually, because this virus spreads so quickly and so easily, it will go into other zip codes, and 16801 is even higher anyway. So I guess just in terms of the reasoning and the logic behind that, is that scientifically valid to exclude one zip code over another? And then if it is, because we're trying to track the increase in the cases, and then know when to open or when to close based on when that increase occurs, then at what point do we pull the trigger? And I don't know that anybody knows the answer to that. So maybe it's not an answerable question, but at some point the community spread will occur. It will transfer from Penn State to the community. It's already started. We need to know, of course, when is it happening at such a fast pace that we want to protect our students and staff. And so I guess I'm just wondering about the scientific validity of that decision about excluding, one zip code over another. And I know we did talk with Maciek about this, and I remember he said, well, there's a difference of opinion whether you think there's 1, 2, or 3 degrees of separation between Penn State and the community. But we all know that there are, for example, Penn State faculty who have kids in the district. There are Penn State students who are helping with remote learning of SCASD kids. And so it's already blended. We have a small community to begin with, and we interact with one another. So I'm not trying to criticize. I'm just trying to point out the reality of excluding a zip code, because the virus just doesn't care about zip code. And so again, if that's scientifically valid, then that would be good to know, so that we can take that into account as a good indicator of when that transfer from Penn State students to the rest of the community is actually occurring and increasing. So thank you.
Thanks, Dan.
Yeah, if I had a stopwatch in terms of the time committed in the conversation so far, Bob basically it was revolving around Randy's presentation as well. We're talking a lot about measurable data in terms of case data, and the geography for that, its density, if you will, in the community. But I think the question was about the virus doesn't care which zip code you're from. The virus does care whether we're using mitigation strategies or not. And we have a plan that provides for, and up to now, for when the kids were in school, and for those who were involved in face-to-face instruction, we've got a pretty good track record in terms of the system's capacity to resist the disease. So I think that's part of the balance in all this. So I think that we can give some more attention to that in terms of to what extent that is serves as a protective factor. We're talking a lot about risk factors, but there are protective factors as well. So I think when we talk about our implementation of the mitigation strategies, they represent a significant protection against the possibility of infection. That's important to keep in mind, because that'll be in a sense the bubble around which our students and staff can hopefully receive a substantial amount of protection from the intrusion of this disease. And I'll refer back to a couple of sentences in the memo that really hit home for me. I just want to mention that on the second page, one of them, it reads like this: the current plan was put into place before we had specific experience as to how COVID-19 would spread in our community. And that is really true. We were setting those cut points and talking about the data without really knowing how the data would be expressed in terms of the real world information we would get from it. So I think we can be forgiven for overreaching or maybe underestimating or overestimating the meaning of the information that was first presented. And we're now in the middle of a course correction. That's what this memo and this proposal is about. Another piece that's mentioned in the memo, which I happen to agree with, is that being in schools is the best option for many of our students as long as it's safe for everyone involved. And that has a number of different meanings for me. I think being in schools is, for those families that choose the in-person instruction, being in schools is an incredibly powerful development, appropriate experience for our kids. This is really where they need to be. And we know from reports from our pediatricians and from the families who are emailing us that their kids are really hurting in the context of remote instruction. There are some who are praised or are pretty positive about our remote instructional opportunities, but it's less it doesn't meet the criteria and standards we typically have for learning experiences within the school district. So I think in terms of the risk protection, in terms of the role of mitigation and the opportunities for kids to be in development appropriate experiences, I happen to agree with that sentence, that being in schools is the best option for our kids. And there are two, and let me continue on. The two other elements I think that are worth mentioning about this is that it is important. The other things they're emphasizing that it's important to understand the presence of COVID in the community and identify when it's safe to have students in schools. That is crucial. That's been a large part of what we've been talking about. But we also have the role of preventing transmission of COVID in our schools. And for some kids, being in school and having these mitigation practices in place may be safer than their being in other settings where they're in group situations, in daycare situations and such, where there's less attention to mitigation. So I think that these elements are all part of the process we're trying to break down and address. I think one of the questions in relation to the application of the revised plan that's being presented what I would need to ask, does this, in any decision we make, will this take into account, let's consider the drawbacks and the risks associated with the decision to go remote? Would we be taking into account the shortcomings of that decision? And also we'll be taking into account the risks to kids that come from the absence of these mitigation strategies. I'm wondering how multidimensional and will this plan be in terms of the role of the safety team in considering being in school versus going to remote?
And I don't know if we can really accurately assess, safety degrees of, kids that are in pods or at a facility in town, because there's no question that's concerning. Are they, carrying out protocol that to the degree that we did, and are their employees, wearing PPE to a degree of our employees? And I don't know. That's a concern. And Matt Ferrari and we talked about that yesterday. And that, there's no question that we have a not just the plan, but what has been done by our physical plant staff. And you walk into, and I did say to the board, if you want to take a walk around some buildings tomorrow, our offices look like bank teller offices with all the plexiglass, and, we want to make sure we're doing everything we can to help our employees be safe and feel safe. And, but Dan, to your question, I just don't know how you could assess that. Listening to families, you've received many emails as well. There's a lot of different information coming at us, and it's unique to each family, but I do think there no doubt is a question there. Are we safer with kids in or out of school with our current circumstances is tough to answer.
It is. There are two elements, I guess, overall that I appreciate. One is that it's, rather than relying on one or two data points, it's multidimensional. There are a variety of different elements about it that are being integrated and are being addressed, if not simultaneously, but in the same decision-making process. There's a number of different elements that are under consideration. And the second piece about it, which I like a lot, is the fact that it's multidisciplinary. And so the safety team involves the nursing staff and involves school administrators, involves Jean and Will as representing the administrative staff, but it also involves pediatricians and the epidemiologists. So it involves a variety of voices. And if they're all provided an opportunity to have a say, if you will, in the process, I think it'll work well.
Jim?
Thanks, Amber. Couple things. So I was going to comment on that, but I think Dr. O'Donnell did a nice job in terms of, we don't know what the situations are when they're not in school, but we can probably assume that there's some mixing, kids from different schools going to the same, care facility or whatever, or remote study facility. So I think that's somewhat concerning. And some of our parents have said that's what they're doing. So I'm glad you talked to Dr. Ferrari about that, because that might be an important data point. It is the measures that we have taken, are the children safer in school than in these sort of situations and not all of them, obviously. Some of them, are home with their parents, but others are going to some of these facilities that have popped up where they're mixing with kids from other schools. I think to comment on Gretchen's question, the reason I think, taking 16802 out of the equation as another data point or another data element is because that is a zip code that we can reasonably assume is all students. And we heard from Mr. Moore the last time, the Vice President for Governmental Relations, we heard from him that the students that either test positive or test and are waiting in quarantine, need to be isolated. Those are the students that are reporting to Eastview Terrace and checking into Eastview Terrace. And according to some, sources, local media sources, Eastview Terrace is about half full right now. So we know that they have about 800 single rooms with their own bathrooms. And that means approximately 400 are occupied now with students either quarantining or isolating. And so I think Penn State has been good in that regard. So that's why I think taking 16802 out of the factor is not a bad number to have when we're weighing decisions. 16801 obviously is more problematic because that includes all of the students that live on Beaver and College Avenue in both the high-rise apartments and the neighborhood single-family dwellings that are rented out. And so we know that there's a good amount of those. We know that those tend to be upperclassmen. We know that those students tend to be more getting into more social gatherings. So that's a concern there. What Scott said, I think, is important too, about that we've made a lot of mitigation efforts since, and I think Dr. Drass brought this up last time, since March and April, we've masked up, we've learned about social distancing, good hygiene, washing your hands, using the hand sanitizer, PPE for our professionals in the schools and our bus drivers and cafeteria workers and everything. So we have decreased the likelihood of spread to a virus that spreads very easily. And so I think based on some of those, yes, it's prevalent in the Penn State community, obviously, based on those numbers and the numbers that Randy showed, that maybe there's a lower limit of 34 cases that are in the community that aren't associated with the Penn State students that are either positive or waiting for the results of tests. The question is, how likely are, and of course this is the impossible to answer question, and the single most important factor is how likely is a student, maybe asymptomatic, likely to spread it to a community member, walking past, shopping at the same places, going, getting takeout from the same restaurants. And I think that's significantly decreased, obviously since we first learned about this and since we first went remote. So I'm inclined to be in favor of more flexible limits in our health and safety plan in terms of what is the real effect of this community transmission? How likely is it that this influx of students will lead to an influx, a spread of cases in the community? So I just want to go on record saying I'm more likely to consider these flexible limits valid. And I like the data that Randy's done. And it was some of the things I was thinking about. So I'm glad you actually put them down in numbers. And I appreciate the graph showed up perfectly in the PowerPoint too, Randy. So nice job. And I just want to say that my inclination is right now in the situation that is, our kids are safer in the schools than they are remotely. And that's what I have to say.
Lori?
Thank you. I am broadly supportive of rethinking our parameters, but I need to say that this refrain that all of the mitigation is that our schools are doing great on mitigation and to put all the mitigation responsibility on the schools is somewhat problematic. I think our community as a whole has to do a lot of work here to support schools so that schools aren't the only place that we have safe surroundings for our kids. So, we can't just rely on the schools to do this. If we're going to do this, everybody has to be all in. Everybody in this community is going to have to make some sacrifices. They're going to have to abide by the protocols put forth by the Department of Health and abide by them closely and faithfully. I just think it's unfair to say that we have to send our kids back to school because everybody else is not doing what they should be doing the way they should be doing it. So I just wanted to throw that in there with the notion that I'm supportive of thinking about our parameters.
Kyle?
Yeah, thank you. So I just had two things that I wanted to kind of mention. The first is that I've heard from friends who are who went in person at the high school before we shut down, that generally the mitigation is very good, but then the one place that it's not is the cafeteria, where people are obviously unmasked. And from what I hear, there's tons of kids in the cafeteria, no masks, sitting 6 feet apart, but inside. And that just seems like something that, if that's true, that would kind of knock out any of the other mitigation measures we might have in place. So if someone who knows more about that might be able to speak to that. And then the second thing I wanted to mention was, I know we're talking about how, like some members have talked about how if we close down the schools, kids might go do other stuff during the day that ends up with a higher risk of exposure, like daycare, stuff like that. So I wonder if it might be possible that we reopen elementary schools, for instance, where kids will have a higher daycare need and stuff while keeping other schools closed. Because it seems like in an elementary school, it might be a safer school environment, because it seems like from research, little kids spread the virus less, and they're already kind of contained within classrooms mostly. Whereas at high schools and middle schools, you have a lot of kids going between different classrooms, mixing with all different kids through the day, and then hundreds of kids in the cafeteria. And it seems like also elementary schoolers, if they don't go to school, are likelier to have to go to daycare or something else because they're just less independent. And that kind of eliminates the benefit that you get from keeping them home. Whereas a middle schooler or a high schooler, like someone like me, for instance, it might not be fun to stay home and do remote school, but it's at least manageable, and you don't need a parent overseeing that the whole time. So that it might be like the cost benefit for elementary, middle, and high school might be different on opening. So I wonder if we could talk about potentially reopening the elementary schools, maybe not the middle and high schools.
Dan?
Yeah, I just want to reinforce what Kyle just shared. I happen to know someone who is within earshot of the PA system at the cafeteria, and it's an easy management problem, but the kids are tending to to congregate before the end of the class period, that be redirected. And I mean, there are things like that that are happening that's an easy fix. But what this calls into question, or what this, I guess what it really leads me to wonder about, and is about whether or not, as we're implementing the plan, that we stay on top of it in terms of its fidelity. And I've asked before, just in passing, just wondering about the possibility of having a weekly or bi-weekly check in terms of some of the conditions that we're trying to create, such as masking and social distancing and hand washing, and just to reassure ourselves through just some quick behavior check, a quick meeting, half an hour, 45 minutes, and not by but by someone in an administrative role or somebody who works in the school, not classroom teachers because they have enough to do, but just to check to see how well implemented these interventions are, because they're all part of what keeps us safe. I mean, we talk a lot up to now, and just in terms of the time we've dedicated to considering risk, we need to be making sure that we're giving just as much attention to the measurement of the protective practices that we want to put in place. So it would be nice, some one of nine, but it would be great if we could have some indication of some ongoing assessment of that, evaluation of that on perhaps a weekly basis, at least to start to see where things are in terms of compliance with the safety plan.
Kyle?
Thanks. I just wanted to add to what Dr. Duffy just said, whereas I feel like even if we reopen the high school, for instance, even if the safety plan is totally enforced in the cafeteria, I still wonder how safe it is to have 200 to 300 people with no masks on in an enclosed space with a virus that we know aerosolizes and kind of just hangs in the air. In an inside space, it seems like even if everyone is doing everything they're supposed to and sitting 6 feet apart with the plexiglass shields, all the rest of it, that I can't think of a single way that it's really safe necessarily to have that many people inside in the same place with no masks on. So I just kind of wanted to say that even if we totally enforce the health and safety plan, might make it impossible for a school like the middle or high schools to go back unless we totally rethink the lunch aspect of it.
I think the middle school students are eating in their classrooms or they're eating outside, one or the other.
Okay.
So, Dr. O'Donnell, with the high school, I'm wondering, this does seem like a significant, maybe the largest area for potential exposure, and whether it's something we can work on going forward.
I know that it's more than the cafeteria, with where Ed and his team have helped Mr. Johnson and the high school staff with spreading furniture throughout the center and down. I mean, there's a lot of square footage, and as Kyle said, we're just a little over a third of what our usual lunch attendance would be if everybody was in on those days. And they have spread it out significantly. There's no question when you have a couple hundred students, that's a sizable number of students. Both courtyards have furniture in them. The larger area with the amphitheater, and then also the back courtyard beyond Section E, where the business and LE programs are located. There's furniture out there as well. Obviously, to be outside, you need pretty decent weather. Thus far, for the days that we've been fortunate. But I know that Ed helped Mr. Johnson with taking advantage of the center space, as well as down beyond the front side of the auditorium. So there's a really large spaces that go well beyond the cafeteria that I think take another look at, and while kids are in lunch, but also maybe we need to remove some furniture from the cafeteria space. The round tables where we usually have evening programs that you've been at with me, there's three chairs per table, so we've removed a lot of furniture as well. But with that said, I think the staff, the principals, keeping an eye on it and redirecting kids, but also just maybe simply getting some of the tables out of there. I've been over there. It is a lot less than what you've ever seen. But there's no doubt we still have, even though we're under 40% of the kids in school on a given day, it's still a decent number of kids. So yeah, we can absolutely keep an eye on it. And like I said, I appreciate showing the board that space, and so you have a sense. And even having members of the safety team that helped us out with this design come over and take a look at what we have going on. As Ed shared in regard to the HVAC system, that was part of the evaluation that occurred, because that is an internal space. Even though it does have some exterior doors, it doesn't have open windows to the space from what I recall. So I think that's a key aspect that we evaluated as well. Ed, if you want to share anything on the cafeteria, or Gene, you guys were both key members of the team that helped us design that.
We did install some large HEPA filtration units in that area to help hopefully, pull some of the recirculate, take some of the virus out of the recirculated air, remove it, whatever's going through that, through the air purifier. So that would help somewhat with the operational aspect of it. And as you said, Bob, we're trying to space out as much as we can.
Gretchen?
I just wanted to add really quickly that what Kyle brought up, I've heard teachers talk about, and that I know some teachers go to their cars, eat lunch in their car to be safe, because they don't feel comfortable taking their mask off in the lunch area where other students have their masks off. Unfortunately, students don't have that option, but it is something I've wondered about too, Kyle. Thanks.
It does seem like this is one of the potentially more concerning aspects of our safety plan in terms of the in-school experience. I appreciate that there are only 40% or fewer of the students in every day, but trying to space them out further, like as Dr. O'Donnell, as you had mentioned, being able to maybe use more of that hallway space to spread people out as far as possible. Laurel?
Yeah.
Oops, I'm sorry, Bob.
And they are spread out over 3 lunches, so it's not one. Just wanted to make sure in case anybody was doing any math in their head.
Mm-hmm. Laurel?
Thanks. With regard to the secondary and elementary, one of the concerns I have, and what I've heard in terms of where the plan is having more difficulty at elementary, is recess. And that makes enormous sense to me. From what I've seen, and this would actually tie into how we're doing our optional workouts. It would, if I had to choose between having students unmasked and trying to keep them, off of very far away from each other and off of any equipment and all, I'd rather say, kids, somehow keep your masks on, but you can have more real recess time. And I think what's happening is because human nature is what it is, and there are a limited number of people out supervising recess. Recess, I think, at the elementary level is probably even more difficult than cafeteria is at the secondary level. So just a thought. And then at some point, Amber, if you could give us some guidance, because I do have things going down through the memo, questions that I have, but I just wanted to bring up that one when we were talking about cafeteria and where the plan is breaking down in buildings.
Okay. Scott?
Yes, so I would like to make a motion to accept the administration's recommendations as spelled out in the September 10th memo per this board agenda.
I'll second. Duffy.
You're on mute, Amber.
Sorry, that's been moved and seconded. And then at this point, we could continue some conversation on the item.
Do we need to?
I have just a question, first of all. I'm sorry, Jim, did you want to?
Do we need to move that to action? So as far as I know, we don't have any action items on this agenda.
Right.
Maybe I defer to Scott Eder.
This is sort of historically, I think, within the district, and certainly those of you on the board and administration, correct me if I'm incorrect in this. Historically, I think we had a pretty standard board operating procedure where something was on the agenda as a discussion item, it needed the full support of the board in order to move it to an action item. As we have talked about, and as I think Dr. O'Donnell announces more or less every meeting, we are in unprecedented times, and our standard operating procedure from time to time has not really been as it's been in the past. I think Gretchen at a prior meeting made what I would have considered a motion on a substantive item that was not previously on the agenda, and then it became an action item. Tonight, her motion was more of, I would say, a procedural motion rather than one that pertained to substance. So I think that a motion of this type is one that historically, from a standard operating procedure of the board, would have been one that required support of everyone. I'm not sure if we're operating under standard operating procedures anymore with the way we approach things. So that's sort of a wishy-washy answer, I understand. But I think we're doing different things than we've ever done in the past because of the circumstances that we're in. I mean, there's no statute, rule, regulation, or district policy that we would be violating if this were to be moved to an action item without a 100% support of the board.
I can accept that answer, and I withdraw my parliamentary inquiry, I guess.
Okay. Laurel?
Well, I still do have the parliamentary question, and it's really goes not so much to being, because it's always bothered me when people are playing games with parliamentary procedure, but it goes to the reason for that historical precedent, which is to not, we talk all the time about not pulling surprises. And this is a big surprise. I'm certain from some of the email I've gotten today, and I think the rest of the board has seen, that it's a surprise to a bunch of people who didn't even, including the board, who did not even have this memo to look at. The board barely got a draft 24 hours ago, and the community didn't even see it till this afternoon. So for that, that's the reason for that precedent, is to not pull surprises. So that's the precedential concern. The other question I have, if we do try to move this, have an action item, is that the memo is very unclear about what amend means. So there are things that are currently in there as to be considered that are no longer on here as to be considered, like absenteeism. And that's why it's a very murky motion to my mind.
Mm-hmm. I think that is a good question in terms of what amending necessarily pulls from this memo and what it replaces. It probably would be helpful to see have a clean copy to vote on with what's being replaced and what's being added.
I think really it's just the cut point. I think there were two key cut points in there that basically say schools are closed when we're over a certain number. That would be pretty much it.
Lori?
So I hear you that those two cut points would be changed, but for me, it would be really useful to see a clear articulation in how would this be articulated in the plan? And then my second concern still revolves around having a plan in place to get enough data about community cases. I don't feel satisfied that what we're drawing from to use as a data point is giving us a clear enough look at what we should be looking at for that particular data point. And I know Randy said that he would potentially be reaching out to those other 2 facilities. That would be very satisfying for me, and I would feel much better knowing that that was part of the data. So I feel reluctant to move on this without that complete information, or access to it, I should say.
Gretchen?
Yeah, I want to ditto what Lori just said, and then also draw on what Laurel said, in that not only have we, through precedent, always abided by, if one board member does not want something to go to action that same night, then it does not. We actually had extensive debate about this specific issue that ended up going to the policy committee, I believe in March or April of this year. I know it was right after the pandemic struck that went to the policy committee. And there was lengthy debate and discussion in the policy committee. And we ended up deciding not to change that historical norm for the board, that if one person does not want an item to go for a vote that night as an action item that was previously in discussion info, then it would not. So it's not just that it would be different, but it would actually defy the entire lengthy debate that already happened about this exact issue just a few months ago. So I would caution that if we end up doing that, then that would set a new precedent for all future items that would be moved and seconded by board members to go to action that same night. And is that really something that we want to have happen? In addition to the fact that it would go against what we already decided on in March with such lengthy debate. Thanks.
Okay. Any other comments at this time on?
I mean,
I'm sorry, Dan. Yeah.
we really talked about not having a reentry plan. And so I'm sorry, Laura, if you felt surprised. I thought that was a very explicit discussion among the board. And we were just trying to, take what is a decision-making process that's difficult. And I don't think the current cut points are appropriate for where we are at this time, but obviously it would take a board action to make any changes. And if there aren't changes, then we'll stick within the parameters of the board approved plan. It clearly, my biggest concern is obviously I don't know when we'll be back into school, and that's why we brought this forward with what I think is a solution to decision making with real-time data, and it was consistent with what Matt Ferrari advised Jean and the nurses and me when we first started.
Yeah, I'm sorry. You had said a reentry plan. It's more the time for us and for other people to consider it that I was referring to, and the sort of murkiness even within that. But you had said that you wanted to bring forward a reentry plan. And I guess part of where I was confused was what I think, and so this is a question to you. I would think that sometimes what your guidelines for re-entry are different from leaving. And what I think I'm seeing in here is very similar guidelines. Is that accurate?
It is. I mean, the process would, for leaving and returning, obviously with returning, I'd look to the safety team in regard to what evidence do they have that feel comfortable that we are safe to return, and what evidence do we have that says we need to go remote. So there's similar issues as far as what are your cut points or what data are you looking at. But again, data is different if it's moving differently, if it's rising or falling. And, I think we've heard that from people on the safety team. And so that would give us an opportunity to analyze it and make a decision with the most informed data.
Yeah, I do share the concern that this was because of, it's taken a certain amount of time to put this together, and it is a lot of work to put together a recommendation like this. For that reason, it was only posted to the agenda this afternoon. There has not been a lot of time for community feedback on, a significant item. I think my recollection of the discussion around whether or not we were going to shift our practice of not moving actions from information discussion to action was that we had this discussion in the policy committee, but there was never, that had not come back. There hadn't been a process yet where that came to the board for the full board to weigh in on a change to that practice. So, I think it would be clear that if we were to move forward with moving this item from information discussion to action, it would be a break with our existing practice, which it did exist for, I think, for the reason Laurel had mentioned of people not being surprised at the table with something being suddenly moved from information discussion to action. And for the community to see something as information discussion, when something's substantive, that's not, sort of a routine item, it's, I think, a different weight to move something to action. On the other hand, this is a pretty considerably significant circumstances in which we're having to make decisions that affect families' day-to-day circumstances. And so for that reason, I can certainly understand the desire to make decisions in a timely way. Dan?
Yeah, there's another irony in all this, but that's not worth getting into right now. I have a question, I guess, for Dr. O'Donnell. Given the fact that we are engaging the safety team in these decisions, and even though the cut points are lower, which were intended to give us more freedom, if you will, to take action as needed, and I personally never interpret them as something that would hang on one data point as the basis for making a decision to change the educational model. And there are a variety of different elements that are in the present safety plan. I was wondering, Dr. O'Donnell, if you feel that you have the capacity in your role, and given the fact the administration has been charged with acting on the safety plan in terms of the circumstances presented by the data and also presented by the needs of kids and such, do you feel comfortable polling the committee, the health and safety committee, and reviewing the possible need for returning to in-person instruction next week? Would that be an option that you would be comfortable including in your decision process?
Yeah, Dan, I don't think there's anything comfortable at all in any of this. But would I pull the team together and have a critical conversation and make sure everybody's heard and analyze it? And then if there are disagreements, obviously, I'd have members of our team there and then we'd be in a spot to make a decision. I do think that is how it goes. That's how it goes with any tough decision to cancel a school day or a school week. They're hard decisions. And I think obviously the board knows you guys have been through a tough one. So am I comfortable doing it? Yeah, I think that's a role that I've been in, and I accept the responsibilities of the decision and the weight that comes with it. And I take it very seriously. So yes.
So and going the other way too. So if you decide, the team could conceivably decide to reopen.
Yes.
Okay, thank you.
Scott?
Yeah, I just real quick, I mean, I get it. I get the concerns, but these are unprecedented times. You know, I can't remember any time in my almost 7 years on the board where we've had, you know, 2 special meetings in back-to-back weeks. I mean, you're right, these are unprecedented times, and I understand that this might be breaking with tradition, but I think that this is an important decision that needs to be made, and especially considering that we have a theoretical stop in 54 minutes. You know, I wanted to get this out there for discussion.
Thanks. I want to, not to throw a wrench into the conversation, but there was an article in the Sunday Daily Times just this evening that was posted, and it interviewed Dr. David Rubin, who has been advising the State Department of Health throughout the summer regarding school reopenings and other matters regarding pediatric health. He's a pediatrician at the Children's Hospital of Philadelphia. And David Rubin has been, I'm sure people have seen his work throughout the summer. In the article today, he's quoted as saying that he had helped develop a COVID-19 model that shows both Penn State and the county must take bold action now before the virus overwhelms the area. There are a lot of people that are worried about Centre County, Dr. Rubin told the CDT this morning. To me, it is a perfect storm. It is a rural area with limited healthcare capacity, and you just welcomed how many students? 35,000, and to me, that's really hard. Without that healthcare capacity, the likelihood they are going to place patients down outside of Centre County is pretty high. Nate Wardle, a spokesperson for the State Department of Health, said, "We are working closely with Dr. Rubin and we share his concerns and recognize the risks that he outlines. And that concern starts with community spread because the college-age population is typically able to weather the pandemic better than the older population. One of the keys is keeping COVID-19 contained to the immediate area of State College and University Park." And so I think my question would be, as we consider how to move forward, there's 2 people quoted in this article who have gone to the lengths of answering questions for our local newspaper about and expressing their concerns about a need for bold action in Centre County before the virus overwhelms the area. If we could please consider reaching out to Dr. David Rubin and or Nate Wardle. I don't know if he's one of the people we've already talked with at the State Department of Health, but seeing Dr. Rubin's, zeroing in on Centre County and the fact that he is actually a pediatrician makes me wonder if there's any chance we could get in touch with him and try and get his expertise, since he has spoken out about his concerns about our area. The reason I bring this up, this was just published this evening, and I think his expertise is unquestionable, and it's a concerning take on what our situation is right now.
Could you just say again where that's published, Amber?
It's in the Sunday Daily Times.
Oh, so it's come up online or?
Yeah, it's available.
Okay. That's fine. I just was wondering.
I'm sorry, I emailed the link to the board email address.
I was more asking for the general public.
Oh, yeah, thank you.
He's not just a pediatrician at CHOP, he's part of their policy lab. So he's got dual backgrounds in terms of, he's got the pediatrics experience, but then he also transitions that knowledge into public health policy recommendations. So it's a dual kind of approach for him on both sides of the coin. And he, as Amber mentioned, I saw him speak at a couple press conferences on behalf of consulting with the state DOH regarding some different things. So I would imagine if he's doing modeling of our area and the current interactions, I would wonder whether he's been solicited by DOH to do that. That's a speculation on my part, but certainly would make sense, being that he's consulted with them in the past. So it may be even just requesting from the state DOH, they may be willing to help us get connected with him if we can't reach him directly. That certainly, CHOP is kind of internationally known, so it's hard to reach higher than that.
Yeah, their policy lab has been advising the CDC and AAP reopening guidelines that they've been providing for schools. So he's been a pretty key voice all along nationally on reopening plans. Scott?
I'm emailing Elizabeth Frank and Peter or excuse me, Peter Frank and Elizabeth Nager on, those are the two DOH people that are meeting with us, and obviously didn't speak like him, and I want them to respond to his article and speak to me if, I don't know if they can get a hold of him.
Yeah, I mean, I think to me, it's just concerning to see someone of this stature talking about our area specifically and calling for bold action. I want to know what the bold action is that he's advising.
Yeah, and part of that article was some commentary from him about, and this is the first I've heard any epidemiologist or public health official mention, but that another key indicator of community spread is actually looking at positivity rates in surrounding counties, which I found really interesting. And that was not something I've heard discussed before as a means of monitoring community spread. But apparently in his remarks, the state, and I don't have it pulled up in front of me, but several of our surrounding counties have actually seen an increase in their positivity rates in the last, I think it was month, several weeks. And that apparently that's a potential indicator of community spread, which I hadn't heard discussed before.
Yeah, it says, although the county has not yet seen large increases in zip codes outside the immediate vicinity of State College and University Park, and although it is virtually impossible to differentiate students from non-students in the data, Rubin says there's another way, a poor man's way to spot widespread transmission, which is testing positivity rates in surrounding counties. Based on those, Center County could be acting as a catalyst for other counties. Clinton County had been down, now it's up. Clearfield County was down, now it's up. Mifflin County the same. He said, you just have to be really careful right now. This is a really tenuous time. I would not ignore these trends in these areas around University Park and State College, because I do think there's a clear, consistent information here in multiple counties that the center of the state has heated up a bit. That's what he said. And I'm just sharing from the article.
I don't want to jump ahead. There are others ahead of me, but I happened to read that article as well earlier today. So I'd like to comment, but only after Scott and Gretchen.
Okay. Scott?
Yeah, I guess my only comment is, really I think we're foolish to not look at all available data. And I think, whether that is somebody who's currently on the safety team or an ancillary source of information, because the whole reason that we're discussing this is because things are changing. And if, I think we're foolish if we don't, leave the flexibility to add additional data points and look at additional pieces of information, whether it's articles, whether it's research, whatever it might be, to include in any decision that we're making going forward. I just think that's the smart way to approach things.
Okay. Gretchen?
Yeah, I wanted to just give support to, because Amber, you had actually posed the question, would we be interested in speaking with him about more direct guidance for us, and because he already wrote about it, and I would definitely support that. And then kind of along the lines of what Scott just said, I had already wondered about, in terms of when we voted on the safety plan, we had said that it was a living document and it would be changed continuously based on new data, new information, as Scott just spoke about. And so I'm just wondering what changes require a board vote and what changes don't require a board vote, because obviously this is coming to us, and it's been, there was a motion and a second to bring it to action tonight, the changes, but in terms of the future, for that to maybe be given some thought, because is it going to come to the board every change that occurs, or substantive changes, and what's the definition of substantive change? So anyway, but in general, I support what Scott just said, that if we have new information, definitely this is a living document, and let's update it regularly. And I do support getting information from the article you cited, Amber.
Okay. Dan?
Good point, Gretchen. I'm with you on that. And you, Scott, as well. And I think we use whatever data is available and whatever's most appropriate and valid to the question we're trying to answer. And to the extent we could draw in not just experts at the state level, but that might go well beyond that. And this individual seems to fill that role. Even if we can go through the Department of Health to ask what kind of guidance they can give us in relation to his comments, that would be great. And it would just add more information, make it more multidimensional, as I was saying before. And reading the article, my sense of it, and I was also thinking of in terms of the audience. Who was the audience he was speaking to? Was he which was it the local community, the borough, which has an ordinance that really reinforces the need for mitigation, or is he thinking about a different ordinance? As I was reading his comments, I was thinking he was telling us all to mask up, wash our hands, and maintain physical distance. I mean, what else beyond? I mean, there are other things we can do, I suppose, but I think what he was trying to tell the community was take this seriously, do what you can, do what's asked of you, and do all you can, because this is risky. This is risky stuff. So my impression from the article was it was really more about reinforcing the need for those basic activities. But again, I could be projecting. Maybe I was reading it before tonight's meeting, so I was thinking about it in terms of our safety plan and its built-in mitigation practices.
But I guess what I would like to know is, because he says we need to take bold action as a community.
What's that mean?
I would like to hear, I think it would be worthwhile to hear what the bold action that is before we move forward with any significant changes to what we're doing, given the numbers we're at. It sounds like he's focused on us, so hopefully it's not hard to get in touch with him. He's taking the calls from the Center Daily Times. Okay.
Well, it will need to rely on our local team as well. I mean, it's great to have someone come in from outside and respond to the data, but we also have the members of our local team who are involved in this process as well. So it's everyone together, perhaps helping out.
Oh, I mean, absolutely. But I think given that he advised the American Academy of Pediatrics in their reopening paper, their white paper on reopening, it would be very helpful to have his attention.
Good point.
Okay. Any further questions or discussion?
Sorry, Amber, in the thread of conversations, I've lost at what point we are. In terms of procedurally.
So there's a motion and a second on the table. And I guess at this point, we're discussing the motion and the second, which is to accept the memo as written as part of the health and safety plan.
Okay, so are we moving forward as a whole, addressing the motion directly? There's no more conversation about, and I'm fine with that. I just want to know. Yeah.
I guess procedurally, it seems like there's no reason why someone can't make a motion in a second. So
I'm fine with that. I just want to make sure that that's been clarified and we've moved past that. So when to make any kind of comments. So.
Okay. Had her hand up as well. I don't know if we're making comments on them, still asking questions about the implications of this or making statements about where we are on it.
Gotcha. Thanks.
Laurel?
Yeah, I mean, it's kind of hard to know what to do because I've spoken a lot. I know the others may want to. I'm concerned that we do have people watching, and especially if we were going to act on a motion, it would be critical to allow public comment. I'd like to allow it anyway.
Mm-hmm.
And so there's that, but the other issue is that there are quite a number of things in this memo that haven't even begun to be talked about.
Right.
And that's a real concern. So again, we've got a procedural thing. So I guess one of my questions is if you could, either you, Amber, Dr. O'Donnell, outline if we do not get to voting on this motion, if we, stick with our adjourning time, if we don't get to vote on it, what are within the next 2 or 3 days? How does that affect what might or might not happen in the next couple of days? Because we have a meeting Monday night too, right?
Well, in regard to decision-making for reopening, obviously the current plan that the board approved would still be in place, so we would not reopen because of where the data points are. The data point with Penn State students with the most recent 7 days.
And your sense is that if we did move forward with this motion, and if the motion passed, then we might, not necessarily that we would, but we might reopen for next week. Is that correct?
If you did move forward with it, I would meet with the safety team and take a look at where we are tomorrow, see where the numbers are, and have a conversation before making a decision.
Thank you.
Bob, I'm sorry to interrupt. Do you have another touch point with DOH, the state DOH, before the end of the week, or are we done with that?
I'm sending that article and asking them for questions, and then also including other information and seeing what they need from me. Now, as I shared earlier, their advisement of us was that this is a local decision, their guidelines. However, I've been trying to push them to take a look at our specific situation in our community, in our zip code specifically, and look at the data that we have. And I'd love to see if they'd be willing to have a seat at the table with our safety team. I know they have a lot going on, but that would be, in my estimation, the best use of everyone's time, rather than simply having them come and have a similar conversation a couple times a week.
Okay. I just wanted to clarify because I know tomorrow would be as Laurel intimated, if everything went forward, there would have to be a decision made about next week. So I just wondered if we were trying to have their input again. So that's helpful. Thanks. I appreciate that.
Yeah, we'll give it a shot. I'm sending Elizabeth Negron and Peter Frank an email tonight.
Great.
Almost done.
Okay, thanks.
Thanks. Yeah. Getting that check-in with them in light of this article, I feel is very critical.
Okay. Oh, well, so I did actually have my hand raised to kind of comment on the whole shebang, if that's a point where we're at. So I'm going to briefly, forgive me, I'm going to briefly veer a little bit away from the meat of the document just to make some points about the time period we're at and the whole situation we're at. And I will do my best to be quick and brief. I just want to say that in the turmoil of the past week, I've spent some time reflecting on what the goal of this school year is. And simply put, it's to do the best we can to educate our students in this unprecedented time, and to do so while we keep the community healthy and safe. And that's no small task in a pandemic. The role of schools has certainly been a subject of a lot of the discussion in the feedback I've received from community members this week. And it raises questions such as, is it the responsibility of schools to keep students safe? And are schools responsible only for educating? And the reality is that for decades, our government and our society have structured our community life in such a way that schools are preeminently required to provide safety to students. In fact, research has shown over and over and over that well before students can learn, they must be safe. They need to be fed, clothed, warm, supervised by an adult. They must be healthy, and most importantly, feel someone cares about them. Without those requirements, the best education is simply not accessible for students. So should schools solely be responsible for every unmet aspect of students' well-being? Well, nothing has demonstrated how precarious it is to rely on a single source of a safety net more than this global pandemic has. And I ask our community to reflect on that issue. As we all struggle through this pandemic, we have to ask ourselves, how can our government at all levels better assist families and children? As Laurel's mentioned and others board members have, I've read every communication we received this week. And as a board member, my focus is to try and support the administration in meeting every one of those needs. And yet we're faced with a multitude of competing priorities in balancing educating students with maintaining the safety of our schools for everyone in them. And the reality is that the safe operation of schools has simply not been prioritized by most people during the pandemic. The schools in our nation have been abandoned by higher levels of government, particularly state and federal governments. Our own state legislature and governor have been arguing over things like sports attendance and the validity of the emergency declaration instead of prioritizing decisions that could help schools reopen safely, such as more access to public health experts, funding for PPE and transportation, support for improving building ventilation, and so on. And instead, districts are doing things like asking parents to drive their kids to school and buying HEPA air filters for our buildings on our existing budgets. Randy's already demonstrated to you the $2 million that we've spent thus far trying to be prepared for this crisis. Our federal government has failed at both supporting financially strapped families and in creating any cohesive national approach to mitigating this virus. And the Federal Department of Education has provided no guidance or assistance on meeting the needs of special education students in environments which require remote learning. So in sum, all these failures have left a multitude of needs at the doorstep of our schools. And to meet those needs, I want kids in schools too. Throughout this process, I have always wanted kids in school, regardless of what some may have assumed, but I want them in school safely. And knowing what safe looks like and when it is safe is our community's unique circumstance and has been challenging at best. And so while I acknowledge the initial parameters that we set by a unanimous board vote previously were conservative, I still support that was appropriate for this volatile and unpredictable first weeks of school for both us and Penn State. The one area where we didn't have data or sense of it was what community spread was going to be like, and that's been a subject of a lot of discussion tonight. Again, I think that we've been, as Dr. O'Donnell has reflected, we're still being let down to some degree by our Department of Health. So they should be advising us on our unique circumstances and providing us with public health expert support. We've been fortunate to gather the support of our safety team in our community. Other districts don't have those same fortunate circumstances. With the new information we have, some degree from healthcare providers and trying to gauge community spread, and now with engagement from the health department, and I hope an ability to get Dr. Rubin to engage with us, I have more hope that we're going to have some assistance in analyzing our local data. I appreciate the district's, efforts to do more each and every time to protect vulnerable staff with additional PPE or other work situations. And, these ongoing efforts are things that lead me to be comfortable with amending our plan and giving that situation to the administration. But I think we really have to hold our Department of Health accountable. They have an obligation to be assisting us. And it's in real strong contrast, the fact that we don't have a county Department of Health. There is a so of the 6 county departments of health in our state, only one has engaged with school districts, and that's Chester County. And they have worked with the districts within their borders as well as Delaware County districts in giving them very specific guidance about their unique circumstances in their region. That's the only county Department of Health that has done that. And not even our state Department of Health has provided that. So I want people to understand that there are failures at multiple levels that have left all this on our doorstep and left us with problems that we were not developed or equipped to handle. So I'm comfortable supporting this amendment, but I also want to reiterate what Lori said earlier to our community. I caution us all that if and when we return to school buildings, that staying there is not certain by any means. Our community needs to continue to be vigilant. We need to minimize exposures that can result in contraction and possible spread of COVID. We need to make personal sacrifices in how we conduct ourselves in our community, despite the fact that we all have pandemic fatigue. Even with these efforts, there will likely come a situation where we may have to close schools again and go to a remote situation. And we need to be prepared for that, and we need to weather that storm as a community. Along those lines, please don't forget flu season is coming, and get your flu shot. Make sure all your other vaccinations for you and your children are up to date. That gives us some of the best chances of staying healthy in schools. And the last thing I want to comment again is that I hope the experiences of the last month that your family has had has driven you to consider how government and community structures can better support families and children, and remove some of these responsibilities from schools so that they can focus on educating, because we can't do that if we're doing all the other things. So advocate for those things, talk to your legislators about them, support those efforts. Engagement on those issues benefits all of us, but most especially our children. And let's work together to find ways that the next time there's a crisis, schools are not the sole safety net for families, and we're not left to tackle monumental health priorities on our own. And that's all I'm going to say.
Thanks, Amy. I also have a statement that I want to make before we vote on this, but I'll let everyone else go first if anyone else has something they want to say before we vote. Okay, Dan? You're still on mute. Oops. There you go.
I do know how to use this process. I really do. It doesn't look like it, but I know where the buttons are, just getting my cursor together. I wanted to just acknowledge that this, my only 5 years of experience on the board, this by far is the most critical period for the school board and for the school district in those 5 years. We've asked a lot from the community in terms of having to shift and change and adapt and turn on a dime. And so I think that we need to, this motion, this action is really important because it empowers our administration to basically act on the data that exists, given the realignment of our priorities, but our expectations for what represents a concern, and it empowers the administration to make the appropriate decisions, given all the things we discussed this evening about the meaning of the data in terms of the incidents locally, in terms of the role of the mitigation strategies that are in the health and safety plan. All those elements are in there together, and I think it's really important to empower the administration to act on the complete, using all the data and recognizing the complete picture and acting using their best judgment in terms of what's needed next.
Thank you, Dan. Laurel?
If there's anyone else who wants to say something who hasn't spoken yet, I'd certainly let that person go forward, because I still had some questions on the actual document as opposed to a statement per se.
Oh, why don't you ask your questions then?
Okay, one of them pertained to this really challenging issue of employee safety. So I've heard from some people, all you care about is the teachers, and I do care about the teachers, but they're certainly not all I care about. And I know that we also have some employees, and including some teachers, who simply can't do their job remotely. It can't be done. So this comes back, though, to how much we've been able to do and will be able to do to protect those teachers and other staff members who would have to be in buildings. A very specific, very detailed question is how many staff members we have who currently are able to be doing their jobs entirely remotely. I guess that's a Linda question. And the reason I think it's important is because I think it helps all of us understand the situation that we're dealing with, and one of the big variables when we talk about choice.
You asked how many employees are working remotely.
Mm-hmm.
We have 5, 6, 7, 8, 9, somewhere in the vicinity of a dozen.
Okay. And we have, I should know this, I'm sorry, I've been on the board a long time. Like 700, like 1,100 employees altogether?
We have almost 1,300 who are regularly scheduled.
Okay. So it's a pretty tiny This is my worry is that feels very small, and anecdotally, with all due respect, I've heard from people, and we don't have names, right? But that has been an ongoing real concern, and it's also a concern then back to the students, because if we have staff members who might be in somewhat compromised situations, that transmission can go both ways. So thank you for answering that.
While I said that, I'm going to say something you didn't ask.
Please.
Every employee who gave us a document from their medical provider requiring them to not be in the building has been accommodated. Most of the information we've gotten from medical providers has said comply with the CDC guidance on PPE.
Mhm.
We have many people who desire to work at home, but we have not been presented with doctor certification saying they are required to work at home.
Okay, thank you. I appreciate that. And we do, and you've already said we have the PPE, so I appreciate that. And then the other has to do with the wording of the memo. And in particular, we talk about individual school closures. It says because we've talked about cut points and how that leaves no wiggle room. Under individual school closures, it says specifically, we will adhere to the Pennsylvania guidelines. So is that, and I'm sorry if this sounds so technical, but we got into trouble once already because of what's flexible. So what, if Dr. O'Donnell, if you could just address what your intention or what you mean in terms of adhering to that?
Adhering to the lower, read that.
It's under, it just says, we will adhere to the Pennsylvania Department of Health guidelines for considering short-term closing of individual schools.
So that would be if we had cases in the building, in the plan that was approved in the memo last week, in the document where we had the closing parameters, you can get to the chart. So if there are any cases in school, that's the actual closing parameters. So it has 5 students or up to 5% within a 14-day period. There you go. Thanks, Randy or Nabil. So those are the closing of individual schools as well is really the focus there of what you see there, Laurel.
So if you can scroll down, Randy. I don't know if you can. This is where I'm concerned about it. It's at the top, it says county level. And then at the bottom, under substantial, which we are by any stretch of any imagination, we are there.
We're double there.
It's what's said there. And I'm bringing this up only because I think that there are people in the community who think that we are just going against all state advice and we are just being nuts here. And it's very clear looking at this, that this is the recommendation. It's not a law. They're very clear. It's a recommendation. And I'm actually okay with that because as hard as it is, with all due respect to Dr. Bader, and I do understand where she's coming from, there are advantages to being local. I mean, it's not advantage in terms of it makes it harder for us to make decisions, and I would appreciate more outside guidance, but local is important, and we are reacting to our local community, and that includes our accountability to represent our local community. So I just wanted to make sure that people were understanding that this is right now what all the advice out there is saying. So that's enough for now.
Laura, can I just, I'm just confused what you said, thought I said that I didn't think local was important because
I'm sorry. I didn't word that well. I'm just saying that along with needing good national stuff, it's also good to have local control. You know, we don't want someone coming in and telling us we must stay open. We don't want someone coming in telling us we must close.
Oh yes, my comments about national were more about more about financial support, providing, I think our state has the responsibility to provide us with public health expertise, but yeah.
Yes, yeah, no, I was just saying, yeah.
Okay, I just want to make sure I wasn't clear, so thank you for
Yeah, no,
letting
I'm,
me.
yeah.
Yeah, on that same page, I think some people in the community had raised some questions about if we were using that 5% or fewer of students with positive test results in a building. And I would assume that our district is not remotely interested in reaching a situation where we have like 4% of students in a building who are positive, especially, when we have 2,000 students in our high school. I'm assume that's not, just to be clear that this document is written for schools of all different sizes. So I would not think that in a building of 2,500 students that we would be looking at a range of up to 5% of them being positive as even a consideration.
I can tell you that would never be something we would consider. I do think the 5, let's just say 14 days. And Laura, I was really pointing to what we'd do if we have cases, and Jean and our team, we've had some discussions around this. So say at the high school, over 14 days, you had 5 people, because this isn't just students. So you had a second shift custodian and 9th grade student, 12th grade student. And obviously that's very different when you have some students or people that are coming into a complex like that over 14 days versus say all 4 people were in the same math class. That's very different. And obviously we would look to see what's coming back from any case that's in a building. We haven't had any yet, but what would be coming back to us through contact tracing to help understand what happened and make a decision. If we're not sure and we're concerned about something, then I don't think there's anything that precludes us from making the decision to close a building because we're concerned about not having enough information about what's transpired if we do have cases in the building.
All right. Lori?
Thank you very much. I too feel compelled to support moving this item to action with a strong desire for relevant data in our community case numbers and a continued pursuit of assistance and guidance by the DOH and Dr. Rubin. And I'm sorry to take up time with what I'm about to say, but I can't let what happened since last week go without being addressed, and I'm not sure where else to say it in this meeting. Last week, 5 of us supported upholding infection thresholds established in the health and safety plan that we're currently talking about, a plan that was unanimously approved and submitted to the Pennsylvania Department of Education. I took those thresholds like I take our mitigation measures seriously. They were promises to our teachers and families that if necessary, we would put the brakes on in an effort to keep them safe. And we were asked to weigh in about upholding those thresholds, and so we weighed in. And so I want to thank all the people who emailed us to share their thoughts, their understanding and support, whether they agreed or not with us, as we deal with a situation not of our own making, a situation that was dropped into the laps of school districts all over this country, a situation that demands school districts address longstanding American societal shortcomings like income and opportunity inequities, lack of affordable quality childcare, unequal access to technology and broadband infrastructure, and a sorely inadequate national preparedness for a global pandemic. Add to this a major university with opaque, dubious reporting of testing and results, and state leaders who flout Department of Health mitigation guidelines while simultaneously demanding a return to athletic competition. I would also like to thank families who wrote passionately and desperately about the situations you find yourselves in. I absolutely understand why kids need to be in classrooms, particularly for you. And then to those who decided to express their dislike of our vote by belittling our intelligence, by calling us idiots and shrieking lunatics, by remarking that they couldn't believe that women wouldn't care for children, by asserting that we women couldn't really and because of our personal circumstances, or accusing us of having agendas, among other things. To them, I will point out that verbal abuse and personal attacks aren't persuasive or productive. They don't contribute to finding solutions. We all of us, devote countless hours to this district because we believe deeply in the value of public education. Since this pandemic hit our nation, those hours have increased tremendously, and we gladly do it because we are devoted to making the best decisions possible for a community we love. Our job at this point is to do the best we can to educate our kids while ensuring their health and safety and that of our staff and teachers. In several testimonials, both in public comment and in emails, people recounted all the large-scale events, from dozens to hundreds to 1,000, that they'd been to without a COVID case. We heard about kids playing together without masks, all sorts of groupings. Those accounts don't make me feel better. If we want kids back in our school, it's going to take an all-in, as I said, from the entire community to practice recommended mitigation. It can't just turn on in the schools and turn off when kids go home. All of the mitigation can't fall to the schools. Everyone is going to have to be committed, and we have to hold one another accountable. If we want kids in school, we are all going to have to make sacrifices to do all of the necessary things all of the time. And I'm sorry for my rant. It just was a week that I felt needed to be addressed. So thanks for tolerating that. Thanks.
Thank you, Lori. Does anybody else have anything they would like to remark on before we vote? Well, before public comment. Okay, I do have a statement I'd like to make. So first, I would like to thank everyone in the community who emailed us over the recent weeks, sharing your family's experiences, the constraints and obstacles that you faced in regard to remote learning, both before and after our district shifted to remote instruction for all students this week. I've read every email and considered the many perspectives, as well as the variety of circumstances that families and children find themselves in when schools are not open. As a parent of 3 children in the district who are enrolled for in-person instruction, I absolutely want schools to be able to be open at any time that is safe to do so. It's very clear that especially for our youngest students, for our students with learning differences, for those who would need to attend another facility for care during the day, and in a variety of other circumstances, that having schools closed can only be a last resort. In our current circumstances, particularly in light of rising infection rates in our region, decisions on in-person or remote instruction have to be based on harm reduction. There are significant risks and potential harms in both routes. In regard to the vote of the board last week, I would like to address some questions in the community as to how that vote related to our approved health and safety plan. Prior to the start of the school year, in accordance with the direction of the State Department of Education, our board unanimously approved parameters for shifting between in-school and remote instruction that were pegged to 75% of the state's recommended cap for shifting to remote instruction. In this, we were not particularly unique among Pennsylvania school districts. Many districts that were experiencing incidence rates in that range began their school year and remain in remote instruction. We are unique, however, in how quickly our county surpassed first our local threshold on Wednesday, the day that we voted, and then the state threshold on Friday for per capita infection rates for in-school instruction. By Friday of last week, Center County was the second highest for infections per capita in the state, and this week, Center County is the highest infection rate per capita in the state, with nearly all of these infections within the boundaries of our school district. We've been very fortunate that at this time, these infections are concentrated among Penn State undergraduates. Our school district was not provided with a template for these decisions or clear guidance from the state, aside from the document with the thresholds that were already used for the decisions to close schools this week. At this time, it will require all of our vigilance and care to protect our community from widespread infection. There have been more infections reported in the past week in our area as all summer long. This is an absolutely critical period for vigilance and exercising extra precautions. I'd like to state that voting on this updated plan tonight is not a vote on whether or not we reopen schools. It's rather providing the superintendent with some further degree of flexibility in that decision making based on patterns of incidents and local data. And I am confident Dr. O'Donnell will exercise caution and continuous vigilance. Finally, I just want to reiterate the concern I have that we lack a complete picture of local testing results to demonstrate community spread without results from MedExpress, which does seem to be a significant source of testing, particularly for those who may not have a relationship with a primary care physician and that pursuing the advice of Dr. David Rubin seems pretty critical to better understand what his modeling may indicate in terms of our community that led him to speak to the media about our situation. So, anyone else? Okay. I'm going to open it for public comment, and I'll start with Shay McGowan. I see your hand raised.
Hi, Amber. Can you hear me?
I can hear you. Hi, Shay. If you could just introduce yourself.
Hi, I am Shay McGowan. I'm the president of SCAA, the union that represents over 650 professionals within our district. SCAA leaders are working with the administration to get students back in school when it is deemed safe, because we know it is best for our students and school employees. While doing so, we are working together to add additional safety measures and reductions of stressors to allow for our educators to focus on doing the best job they can with our students in a safe and responsible manner. The need to continue monitoring and implementing the health and safety plan is paramount. We value the input of the experts on our safety plan. We invite those experts to visit our schools at all levels to observe our health and safety plan in action. Having those experts give the blessing on our plan after seeing how school works would be invaluable to SCAA members. Thanks for letting me make a statement.
Thank you, Shay. Okay, I see Trish Storch's hand up. And if you could unmute yourself, and then you would have 2 minutes to speak. If you could just introduce yourself.
Hi, I'm Trish Storch. I'm the building secretary at Ferguson Township Elementary, and I speak in my role today as president of SCESBA, the Support Staff Association of over 300 members. Our secretaries, K2 pairs, special education pairs, and instructional pairs all believe that they are an integral part of the State College educational system. These people know how important their jobs are to the students we work with on a daily basis. Thus, we are very dedicated partners in the safe return to schools. Our work in the classrooms is important to student achievement, and the support we provide is more important than ever due to the disruptive COVID-19 is causing. New learning situations have required us to learn new technologies, and our efforts to do so mean that our students will receive the support they need to achieve their educational goals. Support staff provides students with continuity, stability, and various assistance they need. The presence of the support staff is reassuring the students at a time when things feel like anything but normal. We all continue to work as a team to support our students. We know that we are better together. We too are united behind the health and safety plan that was painstakingly developed to guide the safe return to the classrooms by students and school employees. The first responsibility of all educators and administrators is to protect the health and safety of our students. SCESBA is grateful to the SCASD administrators and to the board of directors for their tireless effort to bring both students and school employees back to school safely. We encouraged our members to trust in your continued commitment to protect everyone as much risk as possible. Our work with students will be critical to the success of the support centers when the district operates in full remote model. Our hope is that we can provide our students with a positive learning experience by having these support centers. Thank you to the board of directors, Dr. O'Donnell, Linda Pierce, and all other SCASD administrators, and to the community for your continued commitment to everyone's health and safety and to the excellence and education all children deserve. Thank you.
Thank you so much, Trish. I really appreciate your comments. Dana Olendike, I see your hand raised. If you would like to unmute yourself, and then you would have 2 minutes to speak. And if you could introduce yourself. I think you're still muted. I'm sorry. Dana, if you could push the unmute button in the bottom left-hand corner. Okay, I think that's not working. Melina, I see your hand raised. If you would like to unmute yourself, introduce yourself, and then you would have 2 minutes to speak. You'll need to unmute yourself, the button in the bottom left-hand corner. Okay. Nick, if you're online, are we sure that they're able to get through?
Yes, Melina is able to get through. However, it appears that he or she has lowered their hand.
Oh, okay. Ari Giros, I'm sorry if I mispronounced your name. I see your hand raised. If you would like to unmute yourself, and then you would have 2 minutes to speak.
Yes.
Hi, Ari.
Good evening. My name is Ari G. I reside in Boalsburg, PA, in Harris Township. I just moved here in December of 2019 when it was winter break. The topic of remote versus in-person is still in flux, but I felt the need to reiterate my point of view as a special needs student. We should not give up on in-person. Please do not become fatigued by the fluctuations in COVID. It is important that in-person stays as part of the mix. One reason that in-person instruction is important is because students can receive greater support in person than they do in a remote setting. For example, in-person instruction provides teachers with more opportunities to address the diverse learning styles of their students. In addition, the technical difficulties that students may experience at home create barriers to accessing a variety of services such as counseling and study skills. Another concern I have with remote instruction is the additional costs incurred by families. For example, families may need to upgrade their current internet service in order to meet the demand of using the online platforms. Internet difficulties in general are also a large source of frustration for many students during remote learning. I appreciate the current efforts of the district to create instructional learning centers for special education students. However, I continue to be concerned about the needs of the broader student body who would not be included in these centers. We know that the most effective instruction occurs in classrooms, not on laptops. I ask for the board to consider ways to safely continue with in-person instruction to the maximum extent possible. Thank you very much for this opportunity to share my thoughts.
Thank you, Ari. I appreciate your thoughts. Perry Drips, I see your hand raised. If you would like to speak, simply unmute yourself, and then you'll have 2 minutes.
Hi, thanks so much. My name is Perry Drips. I reside in the State College Borough, and I am a staff member at Penn State University. My fiance is a teacher in the district. I would like to vote. I don't believe amending what was outlined in the health and safety plan is a good idea. I will say this is a time, the next 3 weeks, of where I think we need to be extremely vigilant and cautious, not gathering, not having events. And we really need every member of the community to do that. And so I think the idea of going back into a school building or having people congregate in school buildings is not a good idea. That doesn't mean it can't happen. I will say, in terms of the number of tests coming from the university, 700 random tests a day, right, is not sufficient. The total number of tests has been 20,000. They've tested about 13,000. And we have these 430 cases. That is not a clear enough picture to know if we have community spread or not. So the idea that, we just simply don't have enough data to make the decision. So I would highly suggest waiting to see, and I recognize it's a difficult situation for everyone, but I do believe for the health and safety of our students, our teachers, our families, the community at large. And then the last point I just want to make is that we are all one community, and there are many Penn State staff members, students, all living, breathing, working together with members of the SCASD community. So thanks so much, and I really appreciate your time.
Thank you, Mr. Drips. I appreciate your comments. Adam Seitz, I see your hand raised.
Amber,
Yeah.
could I just interrupt for a parliamentary procedure?
Oh, did we reach 10 o'clock? You were right.
Yeah, we set the curfew at 10 o'clock, so I'd motion to extend the curfew by 30 minutes, or extend the meeting by 30 minutes.
Second, Fazard.
All right, that's been moved and seconded. Do we have any discussion around that motion?
Is that debatable? I'm not sure that's debatable.
Dr. Etter?
No, vote.
We can just vote. Okay, and we don't need to take public comment on it either. Is that right, Dr. Etter? We don't have to take public comment on that procedure? Okay. All right, so we'll have a roll call vote then. And the motion, I'm sorry, to restate, the motion was to add 30 minutes to the end time of the meeting to 10:30.
Correct.
All right, Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Zidney,
Yes.
Dr. Bader.
Yes, and just Lynn, my internet just completely died and kicked me out. So if you have trouble reaching me again, hopefully I'm not kicked off, but
Okay.
thanks. Just a heads up.
All right, Ms. Bedell,
Yes.
Ms. Brandt,
No.
Okay, so that motion has carried. And so at this time, we'll go back to public comment. And Adam Seitz, your hand is up next. If you could unmute yourself, and then you'd have 2 minutes.
Thank you. Coming through?
Yes, we can hear you. Thank you.
Great. Adam Seitz in State College. Thank you to everyone who are pulling long hours to keep this ship sailing as best as it can. Your efforts are not unappreciated or unnoticed. Though I don't agree with everyone, this certainly includes all board members. I have to say, I'm really proud of all the elementary students I've observed adhering to social distancing and mask wearing expectations. Gives me some sort of hope for the future. I'm commenting to urge the board to support the district's requested amendment to the health and safety plan. We need to prioritize getting our children back in school, and this is a good path forward for doing so. The merits for doing so were solidly communicated by Dr. Duffy, so I will pull a what he said. Also fully support the sentiment shared by Dr. Bader, and no way I could have put so eloquently. Please place priority in the well-being of our district's children by prioritizing their return to school using the best and most comprehensive data available. I'd like to say I'm discouraged by board members that seem unwilling or unable to pivot quickly from board precedent for voting on action items with short turnaround, and at the same time expect hundreds of families impacted by the issue at hand to pivot quickly in providing safe homeschooling environments while holding down full-time non-teaching jobs. I recall the board voting recently on action items that were similarly added to the agenda to start the year remotely. I understand the argument that community may not have had a lot of time to review, but at any time families can opt to move from in-person to remote learning options if they feel unsafe. This fully mitigates this concern. Lastly, I'm ashamed to be a Penn State graduate. We are Penn State, a machine of self-interest that prioritizes money over K-12 education and the well-being of our community. With great power comes great responsibility. In Penn State, you failed us tremendously. You sold us and our children out. Please halt any donations you may make to the university and call your state legislators to support significant reductions in public funding to Penn State. Until they redeem themselves, hit them where it hurts in the wallet and hold their leadership accountable. They should be let to flounder and operate on reserves for the damage they've done.
I'm sorry, we've reached the 2 minutes.
Sorry, thank you.
Thank you. Josh Weedy, I see your hand raised. If you would like to unmute yourself, and then you would have 2 minutes.
Yeah, so first off, I'd just like to thank all the school board members and also Dr. O'Donnell and the administration for the countless number of hours I'm sure they're putting in. I mean, my biggest concern about kind of bringing students back is the kind of inconsistency in the data from Penn State. The dashboard, it's not clear where all the data is coming from. I've been involved with some discussions with Kelly Walgast, and the data, UP data seems to be okay. Some of the campuses are very questionable, but there's some questions related to what the community spread might be, in particular with some of the slides that were presented earlier tonight. So for example, are the asymptomatic cases that Penn State's reporting, are those cases reported to the Department of Health? And if they're not, then those cases that are reported on the Penn State dashboard, we can't subtract those from the Center County cases. Some other questions that come up are, does this Penn State receive information from some of their contracted service providers before Department of Health does? I'll also point out that the asymptomatic testing at around 1%, the 0.1% is positive, suggests that we have probably an additional 350 cases at Penn State alone. Now, when it comes to the amendment that is being proposed tonight to give some more flexibility, I am fully in support of that, because I do think that we have to be able to make reactions to data as it comes in. And I do trust, Dr. O'Donnell and the health and safety team to make decisions that, will protect not only the students, but also the entire community. And that's all I have to say.
Thank you so much for your comments. And I think we should make sure we check on how asymptomatic data might be affecting our counts, Randy. I'm sure we'll be able to circle back to that to make sure that we're not subtracting numbers we shouldn't be subtracting. Paul Redley, I see your hand raised. If you would like to unmute yourself, introduce yourself, and you'll have 2 minutes to speak.
Thank you very much. Can you hear me?
We can hear you. Thank you.
Excellent. I'm Paul Redley. I live in College Township in Lamont. I have 3 children in the district. 2 are doing the virtual academy, and 1 was doing the in-school option, but is now full remote. It's well-timed, my comment being chosen. I wanted to reiterate the call to look at the data. I have serious questions about Randy's analysis, specifically with the asymptomatic cases being reported. So I asked Randy, please show your work. The slides were informative, but left a lot more questions. And that's what I'd like to see based on, excuse me, the decisions being made on that data. We need to have the best data. And I don't think we have that right now, particularly what was presented. And I was somewhat disappointed with the board's acceptance of it. So please do double check that. Thank you very much.
Thank you for your comments. Christy Shaw, I see your hand raised. If you'd like to unmute yourself, and then you'd have 2 minutes.
Hi, yes, thank you so much. I appreciate you taking comments from the public. I think I appreciate all of your efforts. So I would raise questions, and I think I have specific concerns regarding Lori's comment. The public is doing all that is asked of us. I am masking, my children are masking. I am following protocols with drop off and pickup and busing. My kids are doing all that is asked of them. I ask that you trust in the system that you have built, simply. Trust that you have prepared for this. Trust that you have advise your students and your families and your teachers. Trust in the system that you have created. I don't know what the data says, and I don't trust much of the data that I'm seeing. There's a whole lot left unknown. A virus operates like a virus has always operated. It is undiscernible. You can't control it. The fact that you think that you can, you can't. It's going to do what it has always done. Trust in the system that you built. Trust that you've built a safe place for our kids to go to school. Secondly, my kids are safe at home. They are learning to the best that they can. I am doing everything that I can. I have a full-time staff member at Penn State that is operating in the research entity, and we are thriving. And I am trying to educate my kids and maintain a job as a single parent, doing everything I can. My kids need to be in school. My kids spend too much time on screens. They're not being socially active. They're missing out on opportunities that are beneficial to them, not only on an educational level, on a societal level. This is so important for them to be in school, and I'm nervous and I am passionate about this because I care. The benefits outweigh the risks. Please, please put forward this amendment to at least, like, you've done well. There's no cases in the school. Thank you.
Thank you for your comments. Kevin McGarry, I see your hand raised. If you'd like to unmute yourself and introduce yourself, and then you'll have 2 minutes to speak.
Hi, thank you. My name is Kevin McGarry and I live in the borough. I am deeply disappointed by the short notice of the proposed changes to the health and safety plan. Changes that have potential life and death consequences for students, teachers, staff, and families should not be rushed, but they should be fully deliberated with transparency. It is apparent the district's agenda is to reopen schools at all costs. While some vocal members of our community feel this is top priority, I firmly disagree. Rather than rushing to reopen, we should work to determine how we can safely support students for whom remote learning is not feasible or equitable. Center County now has one of the state's most severe COVID outbreaks. Playing with the data to exclude 16802 is at best unethical and at worst deadly. Symptomatic cases in 16802 include students who have been moving through our community prior to their diagnoses. We've always seen Penn State as central to Center County until now when it has become inconvenient. A number of board members have highlighted families' choice in the educational model, including the ability to change options if they disagree with the board's evolving decisions. It is critical to point out that teachers and staff were not given this choice. In addition, no one from administration or the board has asked for feedback with any formal or systematic way about how the educational model is working or whether the plan is being implemented with fidelity. If the board asked teachers or staff what is actually happening, they would be alarmed. Tonight's proposed revision is concerning because it includes numerous opportunities to weaken previous safeguards. For example, it includes provisions to keep schools open even if up to 5% of the building is infected. I understand that doctors stay safe by wearing PPE and limiting their exposure to patients. I appreciate that they chose to care for sick people, but I also know they are trained, equipped, and compensated accordingly. My wife is a teacher who did not choose to go into the medical field and does not have a choice in the district's plan. While I know she and her colleagues would give their lives for their students, the district has no right to demand that they take this risk when we have designed a remote model to use in an outbreak. Let's not double down on the in-person model. Let's invite all the voices to respond and make decisions with care. Let's spend resources caring for those students who rely on in-person services for access to equitable education. And let's encourage those of us who can stay home to do so as we fight this common crisis together. Thank you.
Oh, I'm sorry. I was talking with my mute on to say that it was past time. Sorry. Michael Hendrickson, I see your hand raised. If you'd like to unmute yourself and introduce yourself, and then you'd have 2 minutes. And you'll have to hit the unmute button in the bottom left-hand corner. Okay. Dave Brown. Oh, I'm sorry. I think we got you now. Michael Hendrickson, are you? If you'd like to speak, you have 2 minutes if you would like to speak.
Can you hear me now?
Now I can. Thank you.
Okay, sorry about that. My name is Mike Hendrickson. My family moved to State College in 1984. I'm a State High grad, Penn State grad. I live now in the borough. My family's been involved in elementary and higher education for about 30 years. And I have 2 kids in high school, both who are slated for in-person learning. My profession for the last 25 years has been focused on crisis and risk management in some of the most demanding environments on the planet. And we mitigate extreme risk by implementing strategies and protocols that allow us to be safe and successful in our daily lives. The single biggest impediment to action is analysis by paralysis. And as it relates to decision-making in the COVID environment, our board's propensity to use what-if scenarios to apply a decision-making model that relies on a zero defect mentality is defeating our ability to move forward with confidence in the State College Area School District's administration. The administration safety plan is the mitigation strategy with the best holistic approach to the health and mental welfare of our students while protecting faculty and staff. So these State College Area School District community members who have determined their acceptable risk threshold and those of us that have elected to send our kids to school have accepted the risk of COVID infection and believe that the safest place of our students is in school. Therefore, I'm extremely disappointed in some of the members of the board who have become paralyzed by analysis and their reliance on a zero defect mentality in forcing our kids into remote learning. Their decisions are having a detrimental effect on our students and families. So I would ask the board to consider the fact that many of our parents in the community are willing to accept risk and put our kids in school because we trust the administration to protect our kids while effectively educating them in the safest and most effective way in school.
Thank you.
Oh, thank you for your comments. Dave Brown, I see your hand up. If you'd like to unmute yourself, introduce yourself, and then you'll have 2 minutes.
Hi, Dave Brown from Spring Creek. Back in March, schools all over the country closed when it was new and unknown. It made sense then, but now it's September. We've learned about the virus and we have mitigation plans. We can't afford to lose another year of school. The board made a safety plan, but you can and should change it. You should never vote against giving yourselves flexibility. We've heard a lot of times that the board has the best plan. You've got the most conservative plan, but that doesn't mean it's the best plan. And I think it might be a good idea to use community numbers, but not include Penn State numbers in your guidelines. A big concern of mine is that the closure was one size fits all. You can't treat remote learning the same for a senior and a kindergartner. Closing schools for very young students is exponentially more disruptive to kids and family. And from personal experience, I can tell you that remote learning does not work with little kids. It requires constant all-day supervision, which is a luxury a lot of people don't have. And the benefits of in-school for little kids is huge, socialization especially. So when you take little kids and put them in remote learning, you lose a lot of benefits from being in school and you create a lot of costs for the families. About 75% of the families chose in-person learning this year, higher for younger children, and these decisions were not taken lightly. Overwhelmingly, parents don't want a first grader in front of a computer screen all day. So if you're leaning for prolonged closures, I think you should have the option to keep elementaries open, even if you close high schoolers and middle schoolers. And once again, parents have a choice. And if it's dangerous or you think it's dangerous in school, stay remote. And it's easy to say, oh, we can just give resources to difficult situations, but it's easy to say that, but hard to do it. And I think we have to look at the whole picture here rather than just focusing on the virus. And the pediatricians mentioned that last time. But I think their views got mostly ignored. So it was kind of frustrating tonight that there was this article from a new pediatrician from Philadelphia, and it honestly seemed a little bit cherry-picked that this article was read
I'm
tonight.
sorry, we're at the 2-minute mark. Thank you so much for your comments. Stephen Williamson, if you would like to unmute yourself and introduce yourself, and then you'll have 2 minutes.
Hi, Amber. I have a question. Is this just public comment on the action item, or is this also general public comment?
This is public comment on the action item, and there's scheduled to be public comment at the end of the meeting, but we also have 10:30 cutoff time at this point.
Right, so likely tomorrow on the other part. Okay, my name is Stephen Williamson. I'm from College Township. I have an elementary school in 1st grade, middle school 6th grade. Really, I just, as far as the action item, I'd like it to pass. But I really just have a question that it has become slightly clear to me, but I just want to hear it, confirmed. Who is making the decision now to open and close schools? Is it 100% the safety team, or is the board voting on their recommendation? That's really all I want to know.
I'm not sure if I understand the question.
So
I mean, the previous decisions were based on the previously approved safety plan and those parameters. So
like the board
made the announcement, but it was within the constraints of the previous safety plan.
Yeah, Mr. Williams,
moving forward would be different.
Yeah.
Who's making the decision on whether to open or close next week? Let's just start there.
Mr. Williamson, if you'd like to, we are not able to engage in question and answer during this time, but if you'd like to send an email, my email address is acc26@scasd.org, and I'll be happy to answer any questions.
Okay, all I want to say now, and you can just turn me off, but who is making the decision on whether to go to school every Friday? That's what I want to know.
The superintendent of schools.
Thank you.
John Wallace, I see your hand raised. If you would like to unmute yourself and introduce yourself.
Hi, can you guys hear me?
We can, thank you.
Excellent. Hi, John Wallace. I'm in Patton Township, and I have 2 children that attend Park Forest Elementary, one who has special needs. And I just want to say that it's clear to me that the automatic firewalls put in place were set a little too conservatively. And I commend you guys for taking a really conservative approach to an unknown situation, but I think that it's very important that we give the flexibility that we need to reopen schools. And to reiterate what a lot of other people have said is, with 2 children in an elementary school, closing the remote schools has actually left me with an impossible decision, because now I need to decide, do I send my children to a daycare where they are not good at masking, they are not good at social distancing, and that increases my risk? Or do I quit my job? Because what I've seen at Park Forest, I will commend everybody. They have been amazing with masking and social distancing. And my children come home and tell me that they have to stay 6 feet away and they have dots on the ground. So I really would encourage the board to trust in the safety plan as written. It seems to be working because there are 0 cases in the school district. There is no such thing as a completely risk-free environment, but the risk mitigation that has been put in place is amazing. And I would encourage you to just give yourself some flexibility and not be constrained by the automatic firewalls. Thank you.
Hey, thank you for your comments. Joel Pretty, I see your hand raised. If you would like to unmute yourself, introduce yourself, and then you'd have 2 minutes.
Hi, thank you. First, I'd like to say this summer and fall is the first time I've really paid attention to school board deliberations, and I've been very impressed by the depth and dedication of the conversations I've been listening to. I did want to question some of the assumptions that this conversation and this action plan seem to be based on, namely that there are no cases in the school district. Of course, the schools can't test. So that understanding is based on self-reporting, which is a deeply flawed, unreliable source of information. So I feel like that caveat really needs to be stated whenever we address the notion of there not being any cases. And 2, there's the assumption of good mitigation efforts. And it's certainly heartening to hear the stories about that, but I'm also hearing stories about teachers not receiving PPE or only small quantities of PPE equipment being provided, or only being provided for teachers over 60. And yeah, I think that's basically, those are 2 things that really make shake my faith in the system that is in play right now. And I hope that will be considered. Thank you.
Thank you for your comments, Mr. Pretty. Charlie White, if you would like to speak, you can unmute yourself, introduce yourself, and you'll have 2 minutes.
Hi, my name is Charlie White. I am a parent with my wife of 2 kids, kindergartner and 5th grader. And this week has been particularly difficult for us, as I'm sure it has been for any other families that have children in elementary school, especially kindergartners. It's really upended our lives. Both my wife and I work at Penn State. We teach at Penn State. We have very limited flexibility in terms of ability to leave our jobs to monitor our children's education from home. So I think the board needs to consider the collateral damage and unintended consequences of pushing kids out of school. It's less safe. Families are teaming up and mixing their children in different homes, and they need to do that because the parents need to work. And I think kids are actually mixing more with potential vectors from the Penn State community by doing that. Children are going to the grocery store with their parents during the lunch hour because their parents have to work in the evenings when they normally go to the grocery store on their own. So I think it's really a damaging situation that the school board, not the school board, but that we put ourselves in. And I think the parameters need to be amended. I'm very much in support of amending that. I do wish there were more options for families that were being forced out of school, that they could have some asynchronous models that allowed parents more flexibility. And I do also want to just defend Randy's analysis of the data. I do a lot of data science in my work, and I thought he did a very clean analysis of that, particularly slide 14. So I urge the board to vote to amend tonight.
Thank you for your comments, Mr. White. Jennifer Black, I see your hand raised. If you'd like to unmute yourself and introduce yourself, and then you would have 2 minutes.
Hi, I'm Jennifer Black, and I reside in Half Moon Township. I strongly agree that the best place for most students, including my own, to learn is in the classroom. However, I also strongly feel that safety needs to be taken into account over all else. I'm not going to urge the board to vote any specific way. I trust that you're going to make the right decision for our kids and our teachers. What I do want you to look into before any voting takes place is the accuracy of the statement that all teachers who need PPE and have requested PPE have the PPE they requested, because I know of many cases where that's not necessarily the case. Students are doing their very best to remain 6 feet apart, but telling a 5-year-old to remain 6 feet apart from their best buddy who they haven't seen in months is really difficult. I feel like what is lacking is information from the teachers who were in school with these students and from the teachers who may or may not have received PPE that they've asked for. So I ask you to please talk to the teachers and get more information before any decision is made. Thank you.
Thank you so much for your comments. Lisa Sternlieb, I see your hand raised. If you'd like to unmute yourself, introduce yourself, and then you have 2 minutes.
Hi, can you hear me?
We can, thank you.
Hi, I'm Miranda, and I'm a high school student, and I believe that high school should be fully remote. There is no situation in which putting our community at risk is justified, and people are going to get sick and people are going to die. As long as we're sending the students back, that's inevitable. I've seen the hallways of State High, and they're packed. Going in person impacts the community at large, not just those who go back. No one wants to admit it, but we have no idea how many cases there are. We're not in touch with all the testing centers, our data doesn't include the entire community, and we don't know how many asymptomatic people are walking around. And it scares me that we're getting so accustomed to crisis and sickness that we're widening the criteria for how many people need to get sick before we take it seriously. In April, five cases would terrify people. Now it doesn't feel like so much. Well, to me, 5 is still too many. So what is so controversial about waiting until it's actually safe? The more patients we have, the sooner we'll be able to go back for good. If we continue on and off between remote and in-person, we're going to prolong the situation and make life exhausting for our teachers, staff, and students. Use the thousands of dollars you're spending right now on making remote learning more accessible for everyone in our district. Use that money to provide families with the necessary support and resources to make remote learning easier. Students should not have to choose between their educations and their lives, and teachers shouldn't have to risk their lives in order to keep their jobs. Focus your time, energy, and funds on making remote learning better until we have another option.
And I'm actually Lisa. Can I just speak for 2 minutes? No, can I?
That would be
No?
okay. Thank you. Well, we
I
have
just like to say that I don't understand why we haven't heard from our teachers. I wonder if they're being told that they'll be punished if they speak. And I really need to hear from teachers. I'm frightened for them. And I don't understand why we haven't been hearing from them at any of these meetings. And that's my greatest concern, is that we not risk their lives. And I'd like to know why they're not allowed to speak.
Thank you for your comments. Leslie McDougall, I see your hand raised. If you'd like to unmute yourself, introduce yourself, and then you'd have 2 minutes.
Hello, can you hear me?
We can.
Hi, thank you. My name is Leslie McDougall. I'm a physician, a neurologist, and my son is in kindergarten. What I wanted to say is that I am hoping that you approve this amendment to the plan. Remote learning is nowhere near as effective as in-person instruction, and remote learning is disproportionately adversely affecting young kids and kids with individual educational plans. The learning centers that they're setting up are nice, but I have to say, with a kid with an IEP, it's not enough, and it's not the same. So what I want to instill is that there is never going to be anything that's 100% safe. I have been very glad to see the precautions that have been taken. And masking, hand washing, and social distancing does work. And that does mitigate the transmission of the disease. So I'm hoping that this plan will be approved and that the people who make the difficult decision on whether we're closed or we're open have that greater flexibility. Thank you.
Thank you for your comments.
Hey, Amber, as a point of order, I think we've
10:30.
10:30 timeline again. I'd like to make a motion to extend the meeting by another 60 minutes, considering we still have 12 community members for public comment at this time.
Is there a second?
Leah, second.
Okay, that's been moved and seconded. Then we would just vote on that motion.
Dr. Duffy,
Yes.
Mr. Fazzard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Zidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
No.
Ms. Concepcion.
Yes. Okay, so that motion carried, and we'll continue then at this point until 11:30. Unless we end earlier.
Amber.
Yes, Laurel.
Sorry, I can't find my hands up thing. I just want to say I am concerned about going so late, and I'm going to just ask that people keep that in mind if requesting with respect to hearing from people, but also if they are just sort of saying, I agree with that is a fine public comment, we still hear it. Thank you.
Yes.
So we don't have to go another full hour if we can avoid it.
Yes, please. Fred Egger, I see your hand raised. If you would like to unmute yourself and introduce yourself, and then you'd have 2 minutes.
Can you hear me now?
We can, thank you.
Thank you. It's Fred Egger, live in College Township. I have 3 kids in the district at Spring Creek, Mountain Indian Middle, and State High. Appreciate all of the efforts tonight. However, this elected and voluntary board is representative of your constituents, the people of this district. That includes the parents, the teachers, staff, and students. I continue to support the responsible challenging of red lines and tenets of this living safety document. I support this amendment. However, in these difficult times, have you considered surveying your direct constituents as to their thoughts and desires to returning to school? In the board meetings I've attended, there have been many board member comments bordering on grandstanding, and to use one of the board members' descriptions tonight, a rant, that are political in nature. This is not about national politics or even state politics. This is about the people you represent. With all the professional input you've listened to, which is very much appreciated, why don't you ask and survey your constituents directly? It can't be a technological problem. Not everyone has the time to sit through these meetings and make comments. Thank you. I appreciate your time.
Hey, thank you for your comments. I see someone with the name Brandon with a hand raised. If you'd like to unmute yourself, introduce yourself, and you'll have 2 minutes. Oh, I see. Actually, it looks like.
Hi, Amber. This is Brandon McDonough. I have a daughter at Park Forest, and she's a kindergartner. I'd like to thank you for your earlier statement up that you read everyone's email that submitted an email over the past week, myself being one of those people. My email was directed to you and Dr. O'Donnell about the need to redefine a reopen plan that's transparent and has concrete metrics. So I'm speaking to support the amendment, but I also urge you to proceed with caution. And I also want to draw your attention back to Kyle Hines, the student who spoke at the second half of the 8 o'clock hour. He asked a question of the board that was kind of passed over, and I'd like to just bring it back up. He was asking you to view the education levels, middle school, high school, and elementary differently because of different environmental factors such as the cafeteria or the need for childcare. And then also, how risks are mitigated differently within those levels of education. And when you revise the health and safety plan, I would like you to keep that in mind, because you already did that with the hybrid model for the middle school and high school and 5 days a week for elementary. When we reopen, consider elementary going hybrid first before high school and middle school, and having that flexibility built into the reopen plan, will lead us into a path that's considering the mitigated risks, the safety of the community, and so on and so forth. And thank you for your time.
Thank you for your comments. And I'll be sure to respond to your email because I think I can address particularly the question of why we might or might not consider that elementary hybrid plan. Dana Olendike.
Hi, can you hear me?
I can. If you could just introduce yourself and then you have 2 minutes.
Will do. So, hello, my name is Brian Olendike, and I have 2 fearless future leaders currently enrolled at Park Forest. I don't normally sit through these other than the post recordings, but I wish you wouldn't focus as much on parliamentary order and passing the buck or relying on anecdotal evidence, because I think that's why these meetings take 3 to 6 hours. You can't rapidly pivot in this age, and yet you expect parents and, more importantly, children who need consistency and structure to be able to do this week to week nonsense. So if you're going to be in leadership and make tough calls, I'm sorry that you get angry emails. I've gotten them before in past positions. I know our kids are worth it, and I do feel for you that people are giving you a lot of angst. As someone who works in 16802, I can assure you that those kids don't move much beyond downtown. They don't have cars. They don't have as much as a mini fridge. They're pretty much on lockdown in their dorms. They can't go anywhere. There's nothing to do. I also teach on campus, and I've seen my class that's supposed to have 22 people in person start out at 14, rapidly drop to 6. I think 6 people in a room equipped for 88 is fine. And this is not uncommon, I'm hearing. It's also magical thinking to believe that we can simply keep our kids home forever and expect them to thrive indefinitely. I trust your mitigation plans, and I've seen them well implemented at PFE. If you are to accept anecdotal data points, then I think you also need to review the Cherokee County School District, or the Hallway School, from social media in Georgia. With minimal mitigation, and even that event, they only have 27 active cases in a district of 40,000. Please review what other countries have done and studies showing that schools with mitigation are not common spreading events. Nothing is ever perfect, and I thank you for being willing to change course. So please vote to amend this.
Thank you for your comments. Jeff Warner, I see your hand raised. If you would like to unmute yourself, and then you have 2 minutes.
Hi, I'm Jeff Warner from Patton Township, a parent of a son in high school and a daughter at Grays Woods Elementary. And lots of great comments tonight. I appreciate all that you're doing to kind of work together to address this. And a couple things I wanted to comment on. First of all, I have concerns. I know that Penn State students, sure, they don't necessarily mix a lot, but I do know that the students off campus are the ones that I'm much more worried about. They are not necessarily remaining in their apartments when sick. They certainly mix more than those students in 16802. And certainly that's a concern of mine. I'm also disappointed that, or not disappointed, but it's reality that there is no required reporting for anybody who gets sick in the school district. And so, and I know there can't be, but that is a concern of mine. So certainly there, while we don't think there's anybody in the school district who is sick right now, we can't know that for sure. We may never know that for sure, but that's certainly a concern of mine. I'm a little bit concerned that the idea of the switching back and forth, say we go back and then we come out again and we go back, that's certainly not good for students. I think it is good for students to be in school, but to be safer, to spend a little extra time at home now, hopefully get the numbers down, allow students to go back, I think may be better in the long run. I have concerns about the fact that we're clearly not going to be out of the substantial level. And as I look at the amendments to the plan, that were presented tonight, it's not clear what exactly was changed, even as I look at it. And so it's hard to tell. I know that the definite cut points are being taken out, but it's not obvious exactly what those changes are going to be. And so that's a concern. If the state is still saying Center County is in substantial transmission, what does that mean? And certainly that's a concern. And then finally, I am concerned that I know these are unprecedented times. We want to act quickly. We want to do things as fast as we can. But this plan amendment only came out this afternoon. Certainly parents have gotten email that there was a board meeting, but they may not be aware that the plan was in place. And with knowledge that we have a meeting coming up on Monday where voting can happen, I don't see the harm in waiting at least until Monday to make a vote on this amendment possibility. Thank you.
Thank you, Mr. Warner, for your comments. Michelle Perrette, I see your hand raised. If you would like to unmute yourself, introduce yourself, and then you'll have 2 minutes.
Thank you. Can you hear me?
We can.
Okay. So thank you. I am in support of the amendment. Just a couple comments. First, I'm the mother of 2 children at Ferguson. People are generally not allowed in my house, anywhere near my house, but now unfortunately I have to let people in my house so that they can help my children during remote learning while I teach for Penn State. So I've gone from a place where my house is safe, unfortunately, to a place where it might not be for my children and my family. I am a statistician, so of course I believe data is extremely important, but the pursuit of perfect data is futile. We should not allow it to paralyze the decision-making process. I'd also like to add, just because I have the same situation that someone else mentioned, that when I do teach in person, my students are nowhere near me. They are very, very, very far away from me, and we're all wearing masks, using hand sanitizer, etc. About the reporting though, I would like to make everyone aware of the fact that students at Penn State are likely highly motivated to let Penn State know that they have COVID or are potentially in danger of having COVID, because the professors get emails that we have to make concessions for their assignments and their exams. So Penn State students are highly motivated to let Penn State know that they have COVID because it gives them concessions regarding those assessments. And then I would just like to add a statement from my husband that would like me to share, that no plan survives contact with reality. Thank you.
Thank you. Thanks for your comments. Joel Coons, if you'd like to unmute yourself, introduce yourself, and then you'll have 2 minutes.
Good evening. My name is Joel Coons. I have a 5-year-old starting kindergarten at Radio Park. And my concern is that this board has already made up its mind. For a SNAP meeting, we've heard 3 prepared statements that drifted out of their lanes into the political. And I would like to see this board give Mr. O'Donnell and his safety team the respect that those professionals deserve. They were brought on board to advise you all based on their professional qualifications, and you need to let them do their job. Our children are being given, or I'm sorry, our families have been given the opportunity to go remote if they so choose, and we fully respect their decision to go remote, but please reciprocate and respect our decisions to have our children receive an in-person education. There are, I take exception with Dr. Rubin being referenced as someone who needs to come in. The CDT article that mentioned him also has a rebuttal by Penn State's Dean for the College of Medicine as to his opinions. And Dr. Rubin's association with the CDC was touted. However, the CDC's official recommendation is that children go back to school in support of their physical, emotional, and developmental health. So I would encourage the school board to stay flexible, listen to the experts you've brought on board, and please respect their opinions. Thank you for your time.
Thanks for your comment. Ona Feinberg, I see your hand raised. If you would like to unmute yourself, introduce yourself, and then you'd have 2 minutes.
Hi, this is Ona Feinberg. I live in Park Forest. I'm also a teacher in the district. Huge thanks to all of you, the board, administration, all the community members engaged in the discussion and all these complex issues. As you consider this action item, I just wanted to add another perspective about remote learning and challenge the idea that we've lost 4 days this week. I've been lucky enough to be in a lot of Zooms and Google Meets this week with kindergartners through 5th grade students and teachers. My own children are full remote this year. They wanted to protect their teachers and also make space for the students who had to be in school. And my experience with remote with both my own children and the ones that I teach is that real learning is happening, real connections are happening, social interactions are happening in that remote environment. Teachers and students are working so hard. It's real school. It might not be perfect yet. I mean, it's only been a couple of days, but there's a lot of good stuff happening. And I wouldn't want anyone to be left with the impression that remote school is a waste of time. So as the board makes decisions in the health and safety plan and the action item, I just want to offer the suggestion that the idea of remote learning shouldn't be considered a waste of time. It might even be considered that although sometimes and in lots of places, it's really hard for a lot of people, in some cases, there was actually more learning able to happen this week than there was in the hybrid model. Thanks so much for your time.
Thank you so much for your comments. Mike Dawson, I see your hand raised. If you'd like to unmute yourself, introduce yourself, and then you'll have 2 minutes.
Hi, this is Mike Dawson. I have children at Spring Creek Elementary and Mount Nittany Middle School. Please vote to give the district the flexibility to make adjustments by accepting the amendment to the health and safety plan. It doesn't mean that things will change right now, tonight, does it? But rather I wanted to point out that one of the things that's become clear, I think, from listening to the past several meetings is that the board, or at least some of its membership, doesn't trust the superintendent to make these decisions. I hope I'm interpreting that wrong, because I do think it speaks volumes. Another point I wanted to make, Kyle sounds wise beyond his years. He first brought up the idea of sending elementary kids back to school first, and others have spoken in favor of it. I'd like to support that as well and really encourage you to think about that as something to amend, or include in the amendment. Perhaps the health and safety plan is, you've learned maybe it shouldn't be a one-size-fits-all thing for returning to school. The elementary schools are smaller. The students are largely in one classroom. I think that it would, I think it would be feasible, or at least I hope you would at least look into the feasibility of that. And the last point I wanted to make, I want to give you a few things to think about regarding that CDT article that you did talk about, specifically the part about community transmission as evidenced by the positivity rate increase in neighboring counties. Is it accurate to suggest that Penn State is responsible for Clinton County's increase when Lock Haven University is located there? I would assume that they're probably going through a similar thing, although on a smaller scale. But rather, wouldn't positivity rates in the Bellefonte area school district with the zip codes like 16823 or Penns Valley with Spring Mills and Tenor Hall, et cetera, wouldn't that be better evidence of community transmissions in areas further away? Thank you.
Thank you. Sorry, I'm getting reverberation on my computer. Thank you, Mr. Dawson, for your comments. Just for clarity, the board discussion, even lengthy discussion around this, is not intended to indicate distrust of the administration, but the state of Pennsylvania required school boards to approve these reopening parameters. So that's why we've been having lengthy discussions about them at the board meetings. Dina Gutoff, I see your hand raised. If you'd like to unmute yourself and introduce yourself, and then you'd have 2 minutes.
Hi, can you hear me?
We can, thank you.
My name's Dina Gutoff. I'm from State College, actually the Hauserville area. My son, who's the fourth and last to come through the district, will be a senior this year, or is a senior this year. So I thank you for the opportunity to speak. Many of us are concerned. We have a very qualified and conservative safety team, which the board approved, who are all experts in their own fields, yet their expertise and insights are being questioned. and not supported by some of our board. It makes us question those board members when we look for outside experts to counter what our own district safety team recommends. We saw this with Dr. Sebastianelli creating unnecessary fear, which the next day had to be corrected nationally. And now the doctor in today's CDT article. For all those that counter the recommendations of the safety team, many of us can easily suggest outside experts who support sending our children back to school. When the decision was made to have a snow day by the school board, which was approved, the next order of business should have been to work on what it would take for a safe return to the classroom. Instead of seeking that out with the safety team and Dr. O'Donnell, the board waited until a special meeting to shoot down the amendments that were brought forth from the safety team experts and create more unnecessary fear and doubt. The board are not the experts in this area. The safety team is the experts, so defer to them. In closing, I look at schools in our area, Our Lady of Victory, St. Joe's, Grace Prep, most of our charter schools, even Bellefonte down the road. And they are all in person, minutes from Penn State, with community members who work at Penn State and who have children who attend Penn State. And many of us wonder why they are still open. They share the same data. They are part of our local community. We all shop in the same stores and eat in the same restaurants. Do they care less for their students and teachers? I highly doubt that. Or is our school board not trusting our safety team recommendations? Defer to the safety team and Dr. O'Donnell and listen to the 74 to 78% of our families who want their students back in person. I support our experts on our safety team and support the amended plan. Thank you.
Thank you for your comments. Jason Narber, I see your hand raised. If you'd like to unmute yourself, introduce yourself, and then you'd have 2 minutes.
Thanks, Amber. Can you hear me?
I can hear you. Thanks.
Okay, great. I just want to comment. My name is Jason Narber. I'm a resident of College Township. I have 3 sons in the district, one in 10th grade, one in 6th grade, and one in 4th grade, one of which has an IEP and one of which is immunosuppressed. And I also have a wife as a teacher in the district. We opted to send all 3 of our children back this fall, feeling that the safety plan was good. And we trusted that it was going to be followed. And I do believe that it has been. The one thing that I have concerns over is the data that's being used. And even one of the data points that was put into the memo tonight, which was the % positivity of faculty. And if you look at the Penn State dashboard, no faculty have been tested for the past 2 weeks. And actually only 30 faculty across the Commonwealth have been tested since students have come back onto campuses. And I know we're trying to separate 16802 from the data because I'm not sure how they're not part of our community anymore, but they do intermingle. And if you look at the latest update on the Penn State dashboard, we currently have 447 symptomatic students who are awaiting results. That's not the asymptomatic, that's symptomatic. And there's only 76 kids in quarantine right now. So based on Penn State's guidelines, we're saying that those students, if they're on campus, they're required to be in quarantine if they're awaiting results per Penn State's outline as far as their plan. So if that's the case, we have a couple hundred kids off campus awaiting results right now who are symptomatic. And if we are saying that they are definitely in quarantine, I think we're being naive.
Thank you for your comments, Jason. Kimberly Paget, I see your hand raised. If you would like to unmute yourself, introduce yourself, and then you'd have 2 minutes.
Can you hear me okay?
We can, thank you.
Okay. My name is Kimberly Paget. We live in Ferguson Township. I am in the medical community. My husband is an employee at Penn State and has been working since March. Just to give you background, I actually have just a few points of, after listening to these few board meetings, I wonder, as many people have already said, how many expert opinions do you need? I feel like the board has completely ignored the experts in our area. So what I did, my best friend works for the CDC. She has a PhD. I just got off the phone with her. She also has a junior at Penn State. They reside in Nashville. She sent her child back to Penn State, who works on campus and is, as many other have mentioned, is taking every precaution because many of those students, especially the ones that pay out of state tuition, they don't want to go home. They want to stay, they want to be educated. So I've been asking myself, how many more expert opinions will it take? And I go back to what Michelle Perret just said, there's never going to be perfect data. I've heard at the last 3 meetings that we're looking at this and you're dissecting this. If there is a positive case, it has to be reported to the Department of Health. It's the law. So anybody that has either symptoms or has been tested and is positive is going to get reported at some time. This is why you're seeing some of these data dumps, because they may get reported at MedExpress or your other testing, and then they get dumped. So that being said, I wonder if we're giving the choice to go remote, why are you not, or I'm sorry, if we had been given the choice to send our kids, why are you not upholding that part? Because I'm hearing the other side, but not really that side. Thank you.
Thank you for your comments. Caitlin Howley, I see your hand raised. If you would like to unmute yourself and introduce yourself, and then you'll have 2 minutes.
Thank you. I am the daughter of a teacher in the district and also a runner of multiple small businesses. So in case somebody doesn't know this, we're being used as a closed study at major medical institutions. I have physicians with the University of Pennsylvania, the NIH, and the Cleveland Clinic. And they have all told me that they are studying Penn State. We have an enormous amount of medical capabilities here, and we're a closed community. So it's a great place to study. And at what point do we send this action back to the state to help us write the plans to protect us, our teachers, and our students? Last weekend, Uber had over 1,000 calls, meaning that the kids at Penn State cannot be trusted. And I just read a CDT article about 20 minutes ago stating that we do have a positive student at one of the charter schools here in town. And I question, what are we doing about contact tracing? So thank you.
Thank you for your comments. Kate Woodruff, I see your hand raised. If you'd like to unmute yourself, introduce yourself, and then you'd have 2 minutes.
Hi, thank you. My name is Kate Woodruff. I live in the State College Borough. I'm a teacher at the high school, and I have 4 children in elementary school at Coral Street. So I want to say that I fully support the board moving forward with the proposal and amendment to the health and safety plan tonight. I want to say that during our first 2 weeks in school as a teacher, I was so proud of my students. They were really near perfect with following the guidelines of the health and safety plan. I didn't once have to ask a student to pull their mask up. It was pretty amazing. So I just want to say that the students are trying really hard. And as a teacher, I want to say that I feel safe with the protections put in place by our health and safety plan. As a parent, my children have been so proud to wear masks and have embraced this new normal we live in during their short time in school. When I asked my kindergartner, if she stayed 6 feet apart at recess, she was like, well, of course, duh, Mom. I mean, she didn't actually say duh to me, but it was that kind of response. So I believe the safest place for my children to be is in school. I feel safe in school, and I'm proud to work for the district and send my children here. And please consider moving forward with the amendment tonight. Thank you.
Thank you. Thanks, Kate. Steve Gutoff, I see your hand raised. If you'd like to unmute yourself, introduce yourself, and then you'll have 2 minutes.
Hi, my name is Steve Gutoff. I'm a parent of a senior, the last of 4 students to come completely through the State College Area School District, which we've been delighted to have in our district. I am fully 100% trust the safety committee to make the best decision for our students based on the most up-to-date data that they have available at that time, free from any political ideology. Regarding this information, I would really like to know, if there's a way you can find this out, Mr. Brown, I'd really like to know the threshold cycles used for testing in our community. And the reason I bring that up The New York Times had an article a week or two ago with a Harvard epidemiologist who suggested that up to 90% of tests with a threshold cycle above 30, up to 90% could be false positives. And we're making some really critical decisions based on the number of tests. Other school districts in Center County have kept the doors open. They have the same degree of separation from Penn State as our community does. Parents who are reluctant to send their children to school, I respect their decision to do that. That is their decision to make. I request from everyone to allow us to make that decision for our own families as well. I trust the safety committee and I urge the board to do so as well. Thank you.
Thank you for your comments. Michelle Rodino, I see your hand raised. And if you'd like to unmute yourself, introduce yourself, and then you'll have 2 minutes.
Okay. Hi, can you hear me?
Yes. Hi, Michelle.
All right. Thanks. Hi, Amber. Thank you for this meeting. I teach at Penn State in addition to being a SCASD parent, and I started getting reports of students with coronavirus. They were telling me about it. And I got even more reports this week with my students being sick. I got even more reports today of the difficulties of actually getting into the quarantine space and what that's like. And if you want to see, there was actually an Onward State article published September 7th, the testimony of the really not good living conditions, like dirty sheets and not a lot of help getting into these Eastview Terrace spots. And if you look at the dashboard, you'll see that if you add the isolation numbers with the quarantine numbers, we actually already have 225 people occupying 400 spaces being dedicated in Eastview Terrace apartments for isolation and quarantine. So we're starting to actually run out. It's only the third week of class. And one of my students who was tested, he said it took a week for him to get the results back. And he was certain he didn't have it because he was asymptomatic. He said he was very mobile about the town. He said he went all over the place. And I've heard other reports like that too. So I'm very concerned. There's no way that this virus is staying contained on campus. That's a myth that I hear from my students. And I think there's actually a lot of structural disincentives for them to even be tested because the quarantine space on campus is pretty horrendous and it costs them money unless they're already living in the dorms. We need to have a plan that offers teachers the choice because we have that right. The only public health right we have right now is to be out for ourselves as individuals because there's not really a massive national health response. And if we can protect ourselves as individuals, it's time we give that right to teachers. Thank you.
Thank you for your comments, Michelle. Jennifer Kroboth, I see your hand raised. If you would like to unmute yourself, introduce yourself, and then you'll have 2 minutes. Oh, is she on?
Hi, can you hear me?
I can, thank you.
Hi, my name's Jen Kroboth, and I'm a parent of 2 children who attend State College Area High School, and I'm also a teacher at Bellefonte Elementary. But I would personally like to commend everything that the board and the safety committee has done to ensure my children's safety. My husband works in the quarantine ward at Penn State, and I can't say much more, but I feel that you have acted in the best interest of all State College Area School District faculty and students, and I just want to thank you for that. Thank you. That was it.
Thank you. Thanks for your comments. I think that brings us to the end of public comment. Laurel, I see your hand raised.
Yes, assuming we will be proceeding very shortly to voting on this motion, I did want to say something.
Sure thing.
I did bring up, and I am concerned about the amount of time that both we and the public have had to look at this document, but I don't want to just throw that out there. The reality is, even if we had much longer, I would still, in this situation, be voting the same way. So I'm concerned about, based on some of the correspondence, as well as some of the comments tonight, that there are people who have an idea somehow that voting for this motion means that the district would immediately return to in-person schooling, or immediately on Monday, or that it means that we would never again be in a situation of going remote. There just seems to be that perception. Other people seem to think that if we did not vote to change the current plan, it means we don't support the safety team, where in fact the safety team suggested this plan that we approved. And I'm very interested in hearing their advice for what would be changed. So I absolutely support them, and I appreciate their efforts and the efforts of their contributing their expertise. It's also been suggested that voting not to make a change means we don't trust the administration. And that, again, is absolutely not true. We do trust the administration. And I think we've all said that at different points. However, I will vote against the motion. And the reason is, well, I'm absolutely willing and very open to adjusting, as someone called it, a living document based on having new information or data or experiences. And we should have cut points that mean that it would be very rare that we would have a meeting, that these are operational decisions, there's enough flexibility, and that those cut points are set at the very outer boundaries of situations where there would be extenuating circumstances that mean that we would not go along with those cut points. So for instance, looking back last week, we had cut points. And I think what I heard Dr. O'Donnell saying was, yeah, the cut points are there because of this, for instance, no cases in the schools and all. My recommendation is we should go ahead. And I think had that come in that phrasing, especially now that we've had these conversations, my guess is we would probably unanimously have voted in support of his recommendation. But there is a value to having on those outer things an opportunity for the public to hear why, even though on paper it might look like there's an obvious decision, hey, you're over this threshold, in fact, we're not going there. That's called transparency, and it's called representation. And it's been interesting to me that we have had people say, well, you need to represent us and yet trust the administration and yet don't ask questions. We can't have it all ways. What I'm asking for, and the reason I'm concerned would vote against this, is that we should have some very broad parameters based on the input of our safety team. In those circumstances, it is our job as representatives to come and listen to the reasons that the administration is recommending that we go ahead despite those boundaries. I think that we do need to make sure that we have a dashboard out there so that people can see all the numbers. I appreciate Mr. Brown's efforts earlier tonight to show us those numbers, and I just want to make sure that everyone can find them on our website. And we also only saw some. There are several data points in here that are listed. Lastly, assuming that the motion does pass, or if the motion were to fail, I would ask the administration to come back Monday night with some new boundaries. So instead of just saying, okay, we'll go ahead with the ones that we have, I'd like new ones that are better. I think that's very important. We have these firewalls, and we need to be able to have good ones so that we're not in every week or all the time. And the very last thing is to be very aware that even within what we are assuming that this passes, there is a statement in there that says specifically that it still has the word, we will adhere to certain things. So it's not like this, even if we pass this, there are no firm boundaries in there. There still are. And in those cases, I would expect that we would be called back to listen, and presumably based on previous experience of usually supporting the administration, presumably we would go ahead and say, yes, we understand. This is why we're going to give you our authority to go ahead and go against what originally was in the plan, not against, but anyway, so that's what I wanted to say.
Thank you, Laurel. Any other comments at this time? Lori?
Just a quick comment that I am supportive of broadening the parameters and giving the administration more flexibility, but I don't support the idea that we should leave the 16802 zip code out of this conversation. I think that they are part of the community. We do not have a strong sense for how well they are being contained. I just think that there are too many question marks to leave them out of this equation, but I am otherwise supportive.
Laurel?
Just very quickly, again, because I'm not sure I said it clearly, as I see it, we are not broadening the parameters. We are removing parameters entirely, except for that one little one that says will adhere to these guidelines. And again, I would support broadening the parameters.
I'd like to follow up on what Lori said about 16802. I understand the recommendation to look at that data differently. I think it might make sense to simply separate those numbers. But we're going to be looking at all of the zip codes, and I guess I don't know that I need to make an amendment to the motion to make this happen or not. But as the safety team is looking at all the data, all the zip codes in terms of where cases are or are not, I would assume that the data that we're getting from 16802 should play into decision making in the correct context, in terms of, if you saw a huge spike there, or that it could be relevant in some manner. I also understand the point about the mandatory quarantine there versus other areas of the community makes it unique. So. Scott?
Yeah, just quick point, that it's a multifaceted assessment. So, my understanding is that there is no one data point that will trigger anything in the conversation. So all data points are relevant, but none are a driver. So include 16802, exclude it. It's data points, but they're not decision points.
Any other board member comments before we vote? Okay. All right, then I think we can have a roll call vote.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
No.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
No.
Ms. Concepcion,
Yes.
Dr. Duffy.
Yes.
Okay, so that item has passed. Moving on in the agenda. Sorry, just a moment. The only other item we have on the agenda is public comment, but I think we've had.
There's one hand raised.
Okay.
There is one hand raised.
Okay. Lisa Harvey, I see your hand raised for public comment. Ms. Harvey, if you're still online and wanted to make a public comment, I think she went away or dropped off. Okay. All right, so in terms of future agenda planning, our next regular board meeting is September 14th. If anyone has any items for that board meeting, please feel free to get in touch with us. With that, I would like a motion to adjourn the meeting.
Amber.
Move Brandt. Sorry. Randy, I'm sorry, I forgot you wanted to give us an update on the food service.
Just 30 seconds, just to let you all know that on Wednesday, we did our first weekly food distribution. The USDA has changed their program, allowing for the summer meal distribution plan to continue through December 31st. So when we are in full remote status, the meal distribution to any child 18 and under can occur. So we're successfully completed that on Wednesday. We will do that again each week when we are in remote, fully remote schooling. And Also, that has been changed is that through December 31st, we will operate under a waiver program where all students in school or in remote or actually in virtual academy can have free breakfast and lunch. And that information will be provided to families. That came out just as we went to full remote. So that information will be provided to families so they're aware of that. But it will be all children. They can get weekly distributions if they're remote or virtual. And if they will have available to them breakfast and lunch if they are in person and we are in session.
Randy, I don't want to hold up the meeting at this point, but would it be possible to get an update maybe in the next finance committee on the financials and how this affects our food service program?
Yes.
That'd be great. Dan?
Yeah, I want to mention to Randy, that is great news. Thank you, Randy. This is a time for extraordinary economic pressure on families. And I'm not sure how that happened, but it really is very good news. Thank you.
Sure.
Yep, for sure. Any other questions? Okay, then with that, I'd like a motion to adjourn the meeting.
So move, Brant.
Duffy, second.
A second.
Okay, that's been moved and seconded. All in favor of adjourning? Aye.
Aye.
Anyone opposed? Okay, then we are adjourned.